Thank you, Chair.
Thank you. Thank you. Good morning. Welcome to today's hearing of the Yoorrook Justice Commission. We are continuing the hearing block number 7, that is the inquiry into historic and ongoing social injustice for Victorian First Peoples. Before we commence, I'd like to ask Commissioner Hunter to do the acknowledgement of welcome to country.
Thank you, Chair. I'd like to acknowledge that we are on my ancestral lands, the lands of the Wurundjeri. Pay my respects to elders, past and present, to all Aboriginal people online or in the room. I'd also like to remind people that due to yesterday's content, there's look after themselves and their well-being. And also there's the 13 yarn line if anybody is really struggling after yesterday's content. May Bunjil watch over us as we conduct Aboriginal business and Womanchika.
Thank you, Commissioner Hunter. Could we have appearances, please, Council?
Good morning, Commissioners. I appear to assist this morning. Thank Commissioner Hunter for her welcome to country. I acknowledge that we're on Wurundjeri lands that were never ceded. Pay my respects to elders and ancestors, and express my thanks for their courage in searching for the truth over the generations.
Good morning, Commissioners. If it please the Commission, Gemma Caffarella, appearing on behalf of the State of Victoria. I'd like to thank Commissioner Hunter for her welcome to country, and on behalf of the State of Victoria, acknowledge that today's hearing is being held on the lands of the Wurundjeri people. I acknowledge them as the traditional owners of this land, and I acknowledge that sovereignty has never been ceded. The State pays respect to Wurundjeri elders, past and present, Aboriginal elders of other communities, and all other First Peoples who are here today participating or watching online. Thank you.
Thank you.
Thank you, Chair. If the Commission pleases, I now call today's first witness, Professor Ray Lovett. Professor Lovett, are you comfortable with me calling you Ray this morning?
Sure.
Professor, do you undertake to tell the truth to the Commission this morning?
I do.
May revert back to Professor as a matter of instinct, but you're comfortable with Ray?
Yes.
Ray, I want to start by asking you to introduce yourself to the Commission and to those following online in a culturally appropriate way.
Ngarra. My name is Ray Lovett. I'm a Nyampa man from Western New South Wales. First and foremost, I also would like to acknowledge country, the Wurundjeri peoples, and pay my respects as well as a visitor to your country. It's very important, to hear that welcome from you, Sue-Ann, but just reciprocating my acknowledgement and where I'm from to be safe in this space today. I'm also a Professor of Epidemiology. I work at the Yadjura Centre, the National Centre for Aboriginal and Torres Strait Islander Wellbeing Research at the College of Health and Medicine at the Australian National University. My primary research expertise is in settler colonial studies, including racism's impact on health and wellbeing of mob. And I also, on the flip side of settler colonial risks, look at the protective and buffering effects of culture, revival, maintenance, and participation as a protective factor against racism and settler colonial determinants. So they're my two primary areas of expertise.
Thank you, and welcome.
Ray, today I want to have a discussion around health inequity and the persistence of health indicators that indicate Indigenous people in this country are not meeting life expectancy, morbidity and other targets. In 2007, the National Close the Gap program was introduced to address discrepancies in decreased life expectancy and increased morbidity rates amongst Aboriginal and Torres Strait Islander peoples compared to non-Indigenous peoples. And the stated objectives were to create equity in those statistics by 2030. Yesterday, we heard evidence in relation to the Closing the Gap program, and it was said that those things are not on track. If they don't move more quickly, then we would not be reaching the 2030 target. So there was evidence in relation to health inequity and progress towards those goals of equity being elusive.
Mm-hmm.
So can I start by asking you about your perspective on the cause or causes of health outcomes and the role that racism plays in health outcomes for Aboriginal and Torres Strait Islander peoples in this country?
So I have a couple of views on closing the gap as a policy initiative, which is informed, I guess, by my epidemiology mind, I'll put it that way. And I guess the premise for closing the gap, while worthy in terms of creating equity of outcomes, there is a problem within closing the gap of where the gaze of what is the standard for outcomes is. And that is for us as Aboriginal and Torres Strait Islander people to be brought up to the standard of non-Indigenous people. So the gaze really seems to refer again to non-Indigenous people as the standard bearer of normality. So that's a starting point that I think is incorrect. And then if we think about what that means in terms of investment and resources allocated under the policy to create equity, there are only two things we can do. The first is to invest in programs and services that increase or accelerate outcomes for Aboriginal and Torres Strait Islander people at a faster rate than non-Indigenous people, which closes or lines come together, or we make the health of the non-Indigenous population worse, which also brings the line together. When I look at resources allocated for closing the gap, I don't see the magnitude of investment at what is currently recommended by the evidence at 3 to 6 times the rate of the non-Indigenous population in any policy setting, whether that's Medicare services, funding to community-controlled services, and the funding formulas that are used to calculate investments into Indigenous health affairs in particular. We're not seeing that investment, even though we've had those recommendations for the last 20 years about the amount of investment required. And then the other side of things, making the health of non-Indigenous people worse to close gaps, is just an absurd proposition. So really the answer is only one way, but we're not seeing that. And the evidence is there to highlight that. We can skirt around the issue all we want. But, we've been divesting from Indigenous health and Indigenous affairs over a long period at the Commonwealth level. Jurisdictionally, it's a bit more of a mixed bag. So until we see that investment change, I'm afraid we won't see closing of gaps or inequity reduced. But it also points to the broader issue that you just raised, is why can't we see our way to investing 3 to 6 times the rate we need to invest in Indigenous health and Indigenous affairs more broadly? And there's this notion that, Indigenous peoples might be getting something additional that non-Indigenous people don't in this country. And that's founded in notions of racism. where we conflate equality, which is everyone being treated the same, with the policy imperative, which is equity. Two different things. So if we're serious about equity, we need to invest to bring people up to the same standard.
So setting aside the closing the gap differential targets, how should we be framing this conversation around equity?
Well, exactly as I just said, we need additional resourcing and investment to create it. If we're not doing that, we're not serious about it. And we need to deal with the underlying issue that stops us from investing in equity, which is racism. If we have to talk about racism and why we can't invest or why we can't create equity, we need to talk about settler colonisation and processes that have occurred over history, but are also continuing, because settler colonisation is an ongoing project, as is racism. And so we haven't been able to, one, talk about racism, the R word, as it's affectionate, as we describe it. But more broader than that, racism is but one manifestation of settler colonisation, and we definitely don't seem to want to have a conversation about that in this country either.
Well, let's start that conversation.
Happy to.
I'm interested in exploring the causes of that health inequity. And your area of expertise is settler colonisation and those impacts. So what were the mechanisms of settler colonisation that resulted in health inequity?
I'd reframe that slightly around what were, but what are also continuing processes. So we as Australians might understand some of that history, but the primary purpose of settler colonisation in the context of Aboriginal and Torres Strait Islander people in this country, there were two mechanisms. So one is to remove us physically from the land, because the land is the resource that was required by settlers to enact their resource base. But there was a problem still. We were still around. So Wolf talks about the elimination of the native via these two processes of physical removal to the margins, and then also the assimilationist policies around, well, if we can't get rid of people, then we absorb them into the population somehow. So that's a particular form of colonisation called settler colonisation. The Kansas countries all enacted those processes, so they learnt from each other along the way. When we look at the history, the Kansas countries, so Canada, Australia, New Zealand, and the US, and Australia, as one of the last in that process, learnt the most from those other countries. So it was enacted perhaps here the most thoroughly.
Those Kansas countries, were they also pursuing the resource of the land, or were there other objects in mind?
Absolutely. It's about the economic base for, Western civilization is land is the largest resource, if we think about it even in contemporary times. In that, if you think about agriculture, mineral resources, and those sorts of things, they are all associated. You have to have land to do that. And so the whole economic base of a society is drawn from land and the resources it provides to society. So that was the primary objective here as well.
The response to that early dispossession, if I can use that neutral term without meaning to strip away the atrocities that were associated with that. The response to dispossession included protection, so-called assimilation of people on missions, and stripping of language, culture, and other practices. So what's your view about that project designed apparently for protective purposes?
Protection of who would be my question back to that. So I often find in Indigenous affairs in particular, when we look at the labels and the titles given to things, a bit like closing the gap in some sense, is who is the reference population or group here that we're talking about. So you could argue that when we're talking about protection as a policy, it was protection, again, of the non-Indigenous settlers' way of life. And so it's always interesting to me when we talk about historical policies like that, and think of that from an Indigenous frame about exactly what was trying to be achieved. So you do not protect people by rounding them up en masse, and if you don't shoot them or murder them, you then transport them miles away from their homelands, put them in segregated communities, ask them, well, you don't ask them, you tell them what they will eat, how they will behave. You tell them when they can leave that segregated area. In fact, you ask them to sign, what were they called? We call them dog tags, to say that if you leave this area, you are never able to return to your family and never able to associate. So I ask the question, who's being protected in that system? If we enacted that now, what would we say about who's being protected? So I go back to the intent. And a lot of the justification for that process, which is around the missions and reserves, was based on racist ideology used to justify elimination or removal of Aboriginal and Torres Strait Islander people from the land. They were moved long distances from where their homelands were, segregated, legally not allowed to leave that segregated area, all on the basis, if you look at any of the Protections Board minutes, which I have done so, that are founded on racist ideology, that Aboriginal people were not intellectually capable of making decisions for themselves, so therefore the state had to protect them from making bad decisions by withdrawing their ability to make any decisions. I'm not sure that's protection.
Your expertise is in epidemiology, a term that we all became somewhat familiar with during COVID. But could you just explain to the Commission and those following how the study of epidemiology can and does look at this history as a relevant frame for health inequity?
I belong to a particular scientific endeavour that has a pretty horrible history in terms of Aboriginal and Torres Strait Islander health in this country. So the primary mechanism of determining our lack in terms of biology, intellect, worthiness has often been defined by epidemiology or other social sciences that use these techniques. So I'm a bit of an outsider on the inside because I also want to understand these scientific techniques and endeavours, and perhaps in some little way use them against the science, but also the prevailing narrative that has historically come from epidemiology. Most people think, to give you an example of that, most people think when we look at Indigenous health and wellbeing outcomes, and one of the really pervasive things that comes from statistics around closing the gap is when we look at outcomes, whether they're social outcomes, employment, for example, income, but then health and wellbeing outcomes as well, like life expectancy. We see this line Indigenous, and then we see this other line non-Indigenous. And unfortunately, what happens in people's minds is they think indigeneity equals disease. And non-indigeneity means the absence of disease. It's a really weird artifact of statistics. But those things are very much conflated. When we think about what indigeneity or Indigenous status means in our statistical productions, indigeneity really means that history that I just spoke about, our present, which we still know health equity is a long way to go. I know that indigeneity as a concept and a marker on a statistical line represents all of those things. It is not a biological innateness or deficiency. And in fact, one of the things I often think about when I think about closing the gap, the Indigenous versus non-Indigenous lines, is what it represents for me is how well settler colonisation has been implemented in this country. So the larger the inequity, the more settler colonisation is having an impact, and the racist or racism present in our current systems, how much they are impacting on the lives of Aboriginal and Torres Strait Islander people. But that's just me, how I think about what those lines mean. But indigeneity as a statistical construct means all of those things. And I think we would do better in Australia to understand that rather than thinking that it manifests in our biology, which is often how it's conflated. A lot of scientific studies, more modern epidemiology, has teased that apart to demonstrate that equity is a result of settler colonial processes, the legacy of those histories, but also what that means in contemporary times as well. But epidemiology has still got a long way to go to tease that apart further. One of the artifacts of racism in science is if we don't like what we might be trying to investigate, we don't invest in it. So the field of settler colonial studies in Australia and in any of the Kansas states, investment has been very poor. I ask the question, well, why is that? If we really want to understand what's creating inequity, we really need to interrogate settler colonialism and the racism that's manifested from it.
The conflation of Indigenous personhood with disease that you're talking about and the persistence of that conflation over history, have you analysed that from a research perspective?
Yeah, obviously that's a lot of my work is trying to pull that apart. Like, what does indigeneity in a statistical concept mean? So, there is some work that I've provided in confidence to the Commission, not published yet, but will be soon, hopefully, where we've been able to pull both what we call distal settler colonial risk factors. So that at the moment, I've got data on five of those. And the distal component means it's been in generations above you. So we're looking at not me directly exposed, but the generations above me. So whether it's my parents, my grandparents, or great-grandparents. And then we've also managed to compile together 16 proximal settler colonial risk factors as well. So they're the things that have been experienced by Aboriginal and Torres Strait Islander people in more contemporary times. And the intergenerational, you would have heard of intergenerational trauma, so that for me is the distal component, that's in generations previous, and the proximal is now.
And is, just starting with distal, is the intergenerational trauma the primary risk factor there?
Well, no, we have 5 of those. So we've talked about one. So the forced relocation,
Yes.
for example, of your ancestors is one I've collected data on from over 13,000 Aboriginal and Torres Strait Islander people across the country, for example. So whether people were forcibly relocated, whether people are unsure about who they are, is a byproduct of forced relocation and removal. I'm fortunate I'm able to say I'm a Nyampa person. There are many, some 40% in the MyQI study, which is the study I direct, a cohort study, an epidemiological study, that are unable to identify their tribal heritage, for example. So that is a distal settler colonial risk. The stolen generations, which is the common language we use right across the country. So we've managed to collect data from those 13,000 people on whether it was a grandparent, whether it was a parent, and those previous generations, uncles, aunties, and so forth. So they're the ones that we've currently got data on from just over 13,000 Aboriginal and Torres Strait Islander people. When we're talking about equivalence in terms of proximal settler colonial risks, people feeling disconnected from culture is a direct result of settler colonial processes. Feeling dislocated from country. Country, as we've all talked about this morning, is a primary foundational cultural responsibility and part of identity. So feeling disconnected and dislocated from that is also a settler colonial risk. Having children removed, you being removed, and those sorts of things. Experiencing racism is also a proximal settler colonial risk. So we, in our team, the team that I had, have managed to compile these 21 indicators right across the country and have put that data together to look at how that impacts on some key health and wellbeing outcomes. And the readings, as you can imagine, not very pretty.
Just so I understand the scope of the study, you said 13,000 respondents.
Yes.
That's the cohort. Yes. Approximately how many for Victoria?
I think it's just over 1,000 people in Victoria.
And, yeah, sorry.
Point out that that's quite a large study of getting mob, for instance, to respond. So I just want to make that point, that when I saw that, I was quite surprised, and I think it's great that we have mob responding. So I just want to make that point that we don't usually get that response.
No, we don't. It does highlight to you, I think, well, I like to think, when it's mob conducting the research. When we spent 4 years talking to mob all over the country about what questions we should ask and what relates, what keeps us strong, what keeps us healthy, but also what impacts our health and wellbeing. And you spend 4 years doing that with community all over the country, then you tend to get better engagement. I think in science and research, we've been saying that for quite some time as well. But yes, you're right, Sue-Ann, it's the largest Indigenous cohort study I'm aware of in a settler colonial nation, certainly by a long shot. The sample or the group of participants is double that's included in the Australian Bureau of Statistics National Aboriginal and Torres Strait Islander Health Survey, for example. They recruit about 6,000 people. We've managed to recruit 13,000.
So as Commissioner Hunter says, that's a significant sample. And can you generalise to the 1,000 Victorians the findings of that study?
So when we look at prevalence of exposure, for example, we can't generalise what the prevalence of an exposure is, so say forced relocation, if we're just looking like that. But when we're doing internal comparisons, so exposure outcome relationships, so if the exposure is forced relocation and the outcome is life satisfaction, for example, or high or lower levels of life satisfaction, generally those comparisons are generalisable to the entire, not just the sample, but to the entire Aboriginal and Torres Strait Islander population. So that's called external validity. It's a well-known phenomenon in cohort studies that you can generalise the exposure outcome relationship across an entire population, which is one of the powerful elements of a cohort study like this.
In terms of that external validity process, are you adjusting for variables like age, education levels, things like that?
Yeah, so there are some things that we do adjust for or to remove the effect of. So some things we know might be differentially experienced by people, particularly by age. So obviously we would hope that younger people are not exposed to as much racism as older people. In fact, in the cohort, we find that's the opposite. Younger people report it more than older people, but we think that's an effect of blunting, it's called, where the older you get, the more exposed you are to something, the less likely you are to recognise what that is, and its impacts on you change. So we do adjust for things like that. We do not adjust for things that standard epidemiologists would have us to adjust for, because they are also involved on the pathway, we call it. So education is also impacted by racism. So you would not adjust for education in a standard regression model like we do in exposure outcome relationships to remove the effect of a higher education attainment, because racism is directly related with educational opportunity as well, and you should not do that.
Do your findings corroborate other smaller studies looking specifically at factors like racism, the effect of racism, and other features that you've mentioned, either distal or proximal?
So there hasn't been a study anywhere in the world that I can find around the distal versus proximal. So our results might be the first on that. In terms of just exposure to racism, we do find that exposure is similar to other small-scale studies. That there has been one conducted here in Victoria, for example, where we're seeing that reports of the concept we measure is everyday discrimination, EDS. I have to also highlight that this is a form of interpersonal racism as well. So people answer a series of questions on experiences they've had. It does not capture what we know is much more pervasive in terms of structural racism. So we don't measure that. It's much harder to measure that. But we find for those, well, I've got the first paper we published on that had 10,000 people in it only, which is still quite a large number, that any experience of everyday discrimination was reported by just over 60% of the entire 10,000 people. That varied quite markedly by whether you lived in urban or remote areas, much higher in remote areas, as you would expect, and a few other attributes. It was different.
Can we make that link between the interpersonal racism you're talking about, people's experiences of racism, and structural racism?
The two go hand in hand, in my view. So people try to disentangle structural racism from interpersonal racism, but structures are made up of people. People build structures. And if those people that are building structures, whether they're our social services, our governments, these are all socio-political structures, they are made up of individuals. Those individuals hold racist views. They then embed them in those structures through policies, procedures, which are often exclusionary. So it's not any great logical leap to say that interpersonal manifestations of racism are reflected in structures.
Just to come back to the features you've described as distal
Mhm.
and proximal,
Mhm.
is there a clear connection between those early features or multi-generational traumas, things of that nature,
Yeah.
and proximal, or what we see in terms of health outcomes today?
So when we look at those people who, it's 63% of people in that almost 13,000 sample have identified a distal risk factor, at least one. Many people have identified multiple. So when we look at those people's outcomes, whether it's high psychological distress, for example, we still see residual impacts across a whole bunch of health and wellbeing outcomes. So a 10% increase or 11% increase in reporting high levels of psychological distress, which is a precursor for many clinical mental health conditions. So that's just one example. So these are people that have not even experienced that historical risk factor, but there is still that association there. It remains. When we look at some other outcomes, including if we look at, sorry, I'll just refer to my notes, reporting of poor general health, we see a 20% increase in reporting of poor general health, which is a universal, globally accepted indicator of health measurement. We see a 33% higher level of reporting in low levels of life satisfaction. Again, another global indicator, well used across many populations. In that group that has reported any of these distal exposures.
And that's just not happened to them directly. Again, that's the
No, that's
generation.
right. These things haven't happened to them. It's been to their family members. So that's just an example of what we're seeing in some of our results for the first time here in Australia. Like I say, similar studies have not been conducted elsewhere. And then when we look at those same outcomes, if I can just add to that, when we look at proximal, so it has impacted you, what we see there is the same results, but the order of magnitude is just much greater. So instead of a 30% increase in poor life satisfaction, we're moving from that to a 64% increase in poor life satisfaction if it's more proximal, so directly impacted by you.
Has your work also considered protective factors?
Yeah, so we have in my introduction, I talked about settler colonial risk as an area of expertise, but also when we did that 4-year development process with the Maikawai study, it was very much looking as an Indigenous person and team conducting this study. We know our survival has been because of strong. For many of us, or some of us who have been able to maintain or reconnect those cultural practices or revitalise those things. So we wanted to capture the essence of those things as well. So we developed a bunch of what we're calling cultural wellbeing indicators as well. And so that's the other work that we're doing at the same time, because we don't want to just say how bad things are. We want to be able to say, well, these things help or don't help in this process. So, for example, some of the work we've been doing on language revitalisation, Aboriginal and Torres Strait Islander language revitalisation, for example, show that there are protective effects against mental health conditions. For example, there is, it is complex to tease apart. Well, if you're going through revitalisation, the trauma of loss. And then there is trauma involved in revitalisation, but that's an Indigenous desired outcome. It's not foisted upon us. Then there is also some trauma around people wanting to reconnect and maintain cultural practices as well. And then for some people where land tenure has really changed and are unable to participate, again, if we're saying that's the only solution for people, that's also quite dangerous, because if people are not able to engage in those practices on country, then we may be adding further harm to that if there's no possibility of that. So we need to be thinking about all of these things.
And would you put the pursuit of self-determination in the same bucket?
Well, when we look at our results in the research, that's one of our questions, or one of the outcomes we're very interested in. We talk about it in terms of life control. So it's that same concept of self-determination. We're very interested in that in our research. And it's interesting because whether it's the distal or proximal settler colonial risk, when we look at the impact on life control, or poor life control in particular, it is one of the largest effects we get in our results, that racism and these risks impact on poor rates of poor life control the most. So, settler colonisation and exposure to racism has done its job. We are talking about people with high levels of exposure to racism and these risks. We are talking about highly compounded reporting of poor life control in the order of, in some instances here, when I'm looking at exposure to racism, children being removed, we're talking 200 to 300% increases in reporting of poor life control, for example. So it is having huge impacts. But when we talk about cultural well-being as a buffer or as a protective factor, it is one of the very things that improves the fastest when people are exposed to language, to country, and those sorts of things. So it has the ability, it seems, to reverse some of those impacts or buffer them when these other things are occurring or co-occurring at the same time.
How widely recognised is that fact amongst, say, medical profession?
I'd have to say it's not really well recognised at all. As Indigenous people, we talk about self-determination a lot, or agency, fate control, life control, however we want to frame that. We talk about that first, governance, decision-making, power. But if we put it in the health context, if we also know there's a broad literature on if clients and people receiving services feel that they have agency, feel that they have control, feel they are able to direct service delivery and how that occurs, then outcomes are much better. So it's, again, not a large logical leap to make that if we ensure that those processes are within these systems, then you do get better outcomes. It just happens to be in a slightly different cultural context, and we seem incapable of being able to accommodate that in our service systems, unfortunately.
Would you say it's more of a, when treating for any type of health, it's more a medical model, and then the culture is to bring someone in and it's an add-on because you bring the Aboriginal person in? Yeah,
that seems to be how it manifests in our current health system. Is it's very much that biomedical model where it's an artifact of the training of health professionals as well. I used to be a health professional before I became an epidemiologist as well, and the training you receive is what causes the illness, either in terms of pathology, and then how do you treat it to get rid of that pathology. So that's often in isolation of the individual and the context in which they live. That's why some people will say social workers might have been invented to deal with all those other social aspects of people's lives. But then when we add a layer of cultural continuity or cultural care, again, we see that divergence out of the medical model to another service sector that provides that component of it. It'd be really nice, which is what a lot of the policy documents are trying to do around cultural competence of health professionals and the like, that people actually are able to not provide cultural care. We don't want non-Indigenous people providing cultural care, but at least being able to facilitate care that does no harm, which most health professionals have agreed to provide in their oaths. So I think you're right, that does go on quite a lot. The Aboriginal community-controlled health sector has done a lot over the years to try and ameliorate that. But again, when you look at who has primacy and power in the health professions, we all know who those people are, and often there is a tension. I've worked in Aboriginal community-controlled healthcare as well. There is a tension between who are the experts. Is that the clinicians, or is it the cultural knowledge holders within a community? And how do you bring those two things together? Has always been a tension, I think.
Yeah, we did hear evidence yesterday around not being taken seriously because it's not researched enough, and that the clinical model is always put above the cultural model.
Yeah, so we call that epistemic violence. So it's around whose knowledge counts. Yeah.
I want to ask you about the proximal factor you identified as racism.
Mm-hmm.
In your work, are you able to say to what extent is racism responsible for poor health outcomes?
Mm-hmm. So we did publish a piece in the Lancet at the end of 2022, where we used a technique called a population attributable fraction. And what that means is we take an exposure, we look at a particular outcome, and we try to attribute how much of that outcome is alone attributable to that exposure. So the exposure in this instance was interpersonal racism, again from this nearly 10,000 Aboriginal and Torres Strait Islander people we used in that analysis, or it might have been just over 8,000 when you exclude missing data. So the exposure was interpersonal racism. The outcome was high psychological distress, that precursor to some of the clinical mental health outcomes. So we were trying to tease apart, using this particular technique, well, how much of that high psychological distress is attributable alone to racism exposure. Now, the caveat on this is, again, you could argue that racism is ever present and it's 100% of Aboriginal and Torres Strait Islander people are exposed to it, but we're using very conservative approaches here. I mean, epidemiology and sciences, we're very conservative. So we only took the information from those people that reported their interpersonal experiences. So this is likely an underestimate, is what I'm trying to get to. And so when we looked at what the gap in that outcome is, so we found that half of the difference in high levels of psychological distress were attributable alone to racism exposure. So 50%.
Just some explanation of terms. You've talked about interpersonal racism and structural racism. Yep. Could you describe what structural racism is?
So structural racism is when your systems are embedded or codified with racist elements. So that could be it's designed to limit opportunity for service, employment, or engagement in systems. So it's usually policies and procedures that people adhere to rigorously, I have to say, in organisations. And the intended, unintended consequences of that for particular groups is it manifests in an inability to access or use services appropriately. So I'll give you an example in research, is when we're conducting research on a particularly prominent health condition for Aboriginal and Torres Strait Islander people, cardiovascular disease. And if there's a new treatment which is quite promising, But the eligibility to participate is for those aged 45 years and above. Now, from my work, I know that cardiovascular disease risk starts for Aboriginal and Torres Strait Islander people much earlier, from 20 years of age. So we have a whole period from 20 to 45 that Aboriginal and Torres Strait Islander people are not eligible to participate in this research because their evidence of when this risk starts has not been incorporated into the science. That's just research.
Mm.
People think that just setting eligibility criteria, I love looking at eligibility criteria for things because that's often where it starts. If we look at eligibility criteria for services, programs, and the like, it often begins there. And what services are trying to do is limit use, not include, limit. And so for particular groups in society that you are meant to service everybody, as soon as any difference in those factors that may be present to make you eligible, it becomes discriminatory, exclusionary.
So just to identify one of the articles that you may be referring to, there's an article that you've published in the International Journal of Environmental Research and Public Health, Prevalence of Everyday Discrimination and Relation with Wellbeing amongst Aboriginal and Torres Strait Islander Adults in Australia. So just so that we identify that as one of the research papers you've undertaken.
Can I just, that's a really, really good point, and that's a point that we heard a lot from our women in prison about being excluded from being able to access programs that would help them get released earlier, or would help them get care, or would help them, actually our men as well, to be able to move through the system quite easily or have a better chance of being paroled earlier.
It goes back to my point earlier around what are we trying to do? Equality or equity?
Yep.
Right. So equality means everyone has the same rules and therefore eligibility criteria. That's not what we're trying to do here. What the game is equity. And what that means is eligibility has to be tailored specifically to the group you're interested in providing services for. If we're not doing that, we're not serious and we're not doing things that we should be doing. We're not meeting our obligations to what we said we would do.
If we talk about a lot of health eligibility to access things, then we're excluded from a lot of the norm is the mainstream population.
Yeah,
level, that line you were talking about earlier?
There's a term I use for that. I don't know whether I should say it publicly, but it's the tyranny of the majority. The problem we have in this country is as soon as we start thinking about different groups within society, we no longer become eligible for things, because what eligibility is built around and when we think about public health, the greatest good for the greatest number. That's what public health is trying to achieve. As soon as we create that notion, the greatest good for the greatest number, who are we leaving behind in that? If we're truly committed to equity, it shouldn't be we should have the greatest good for the greatest number, but we should also be catering to groups so that we have the greatest good for the greatest number. That's everybody.
Just want to share with you some examples of the evidence that Yoorrook has heard. These concepts of racism are challenging for many Australians, and I want to raise some of these examples with you in a broad sense and invite your comment on them. So Yoorrook has heard evidence of clients being turned away by health services without proper management of the condition, of discrimination in access to health services and infrastructure. For example, areas within hospitals having to deliver babies on hospital verandas, not being allowed inside. attendance of child protection workers at birthing units immediately after delivery and separation of mothers and babies in custodial settings, inadequate provision of healthcare medications and supports in custodial settings, or even from primary carers, police and corrective services response to public drunkenness, addiction, and a punitive criminal justice response. So there are some examples. I'm characterising the nature of the complaint. Some examples of difficulties people have experienced that have come up in the evidence. Can I invite your reflection on the nature of racism and the work you've done and how it presents itself, the impacts it has on people?
Sure. I mean, a lot of these situations are cyclical as well. So the first scenario you talked about, people being turned away or not receiving the care and that they need. We do measure that in the MyQI study. But the fundamental underlying issue in terms of racism for that scenario would be whether Aboriginal and Torres Strait Islander people are seen as worthy of receiving appropriate care.
Just pausing there. I mean, it might be shocking to a health practitioner to think that they had this attitude. Might be shocking to others to think that health practitioners are acting in this way.
Well, if you look at the underlying racist narrative that goes on around Aboriginal and Torres Strait Islander people generally, so this is where we'll use stereotypes, is that Aboriginal and Torres Strait Islander people don't look after themselves. So why, as a healthcare practitioner, do I need to? So people really need to interrogate why they don't provide service. And now I'm not saying that that is the case, but that is the perception that is widely held in society. We have to be real about this. If we're not able to look at this as a health professional, I used to work in an emergency department. I definitely observed other healthcare providers, not providing their service they needed to Aboriginal and Torres Strait Islander clients because of, if Aboriginal and Torres Strait Islander people are not going to look after themselves, well, why would I?
And where does that come from? Is it modelled by senior practitioners, or is it innate in our community?
I have to say it's innate in the community because these are general stereotypes held, right? And whether you're a health professional, a senior clinician, many years of experience, you are also part of a society. If you are part of a society that holds these negative views about Aboriginal and Torres Strait Islander people, we know why these stereotypes are created, as I talked about earlier, to eliminate, to assimilate. Then if you're part of that society, as a health professional, we also measure racism experience in the health system as part of that same paper that you highlighted before, that it is still going on in these health systems, and it is common. So I don't accept at all that as an educated clinician, you are any different to a member of society that holds these views about Aboriginal and Torres Strait Islander people. It is illogical to suggest otherwise. So that's the worthy component. The next scenario you gave was that care and protection services are showing up at births. So if we look, I've already talked about stolen generations. If we're looking at features of the settler colonial project and risk, then this is a morphing of that system. Because again, the Aboriginal and Torres Strait Islander people, the widely held view, which we have evidence of, is that Aboriginal and Torres Strait Islander people don't look after their kids. So any risk to what a healthy, well-adjusted child might be from birth, even in utero, is examined, scrutinised by these professions. And so you can imagine if you've had your grandparents removed, your parents removed, the modelling of good parenting, that's also a settler colonial process. And then you're giving birth, you're worried about removal already, you've had limited opportunity through the education and employment systems, and you still expect that person to be a model parent when you've had all these distal exposures flowing right through to your contemporary life, yet we just expect people to be model parents? Are we serious? So it is real for Aboriginal and Torres Strait Islander people and people giving birth, this concern. In our data, in the last 12 months, we ask a question, in the last 12 months, has a child been removed from your care? 10% of people are reporting that. 10%, 1 in 10 children in the MyQI study or participants are reporting removal of children in the last 12 months. It is not a lack of Indigenous parents being able to care for their children. It is a society and a system that has been systematically built and enabled over time to allow this to continue. Sorry.
Not at all.
No, I
And in
just say
fact,
don't be sorry, because I think you've just summed up a lot of the evidence that we've heard, and a lot of what you've been saying really, I guess in a more nuanced way than I ever could, speak about how the system excludes.
Yep.
And it is racist, and before your child's even born has already, and we've heard evidence of people where the child's there, and I will say as early as 2 months or maybe even less, of a woman ringing me giving birth who was judged on her history,
Mm-hmm.
and they were outside that door. So you've just explained that perfectly,
Mm-hmm.
and thank you, because I think our parents need to hear sometimes that it's not them, and that they are good parents, and that there is a system. And I'm not sure if you know, Ray, but we have the highest rate in this state of child removal. So I hope some of our parents that are listening can hear that it isn't them majority of the time.
And even, just to reiterate that, and even, when, you do think you're not parenting well enough, that it's actually not their fault. This is the other thing, that these systems are designed and set up to perpetuate this. And if there's never been a remedy to that system, investment in that system, investment into the family, then, it explains a lot.
I should add that in the child protection and criminal justice work that the Commission has undertaken, senior officials and responsible ministers have acknowledged the inherent racism in the systems, including in the protective measures that they have undertaken, using protective, again, risk assessment models. And
so there is, again, just reflecting on this word protection. So when the state makes a mistake, it's catastrophic. It's often reported that way. So again, a lot of these systems are designed to protect the state. Yes, you do need to protect the state, but you also need to correct the state. And how do we do that? You don't want to get in that situation in the first place. You should be resourcing, investing in families and communities to be functioning well within culture and autonomy. But there seems to be a real reluctance to do that.
I want to move in a moment to what do we do about it in terms of anti-racism strategies and what your observation is of what's working. I just want to pause there to see if commissioners have other questions around the expression of racism or the prevalence of racism.
I just want to make a comment just to say that, you're talking in a medical context and health and well-being context, but the legislation that enabled the behaviour of the people that came before with us for over 100 years. Over 100 years. So there's a psyche within the population among some professionals, whether it be the legal, the social workers who did very well, the latter part of the legislation when it was softened from protection. But the specificity of some of the early legislation has embedded attitudes in this country, in this state, that are hard to, to be rid of, really. And it's embedded in some of our fellow people in Victoria. And you described it beautifully. From the health point of view, we don't think deeply about that, but we have the lived experience which you're capturing in this context, which is really it's some kind of evidence. Is so important.
I think that's a great point around the structural racism, just how embedded it is, and you think about those laws that were created, the legacy of those, even though they may have been repealed, as you say, it lives on, often in the minds and practices of these professions.
I want to make a comment on something you said a bit earlier that we heard quite a lot of, but about systems and people designing the systems and structures they didn't create themselves. And we've heard evidence throughout this commission as well around the lack of accountability on the system, but also on the individuals who are implementing the system, whether it be child protection failures, whether it be deaths in custody. We can keep going on the health system where we heard some case studies yesterday, the lack of accountability in these systems. But when our people muck up or do something wrong or don't do anything at all but just be Aboriginal, look what happens to them, systematic racism. But also you had a truth-telling commission, so you don't need to apologise for sharing the truth.
Well, sometimes it gets a bit personal.
I just wanted to ask, is there anything particularly stood out? I think you said you had 1,000 from Victoria that you could possibly share that stood out with your study. You're able to share with us?
Yeah, I think I can probably just share. It reflects back on some of the questions around the types of how racism manifests. So the most common, I've alluded to it before about how Aboriginal people are perceived. So the intellectual inferiority, which is why other people have to manage us, because we're incapable of doing that. So, that's 60% of all the people in the sample, so that includes in Victoria as well, reported that. So that must be a horrible thing when people are thinking that about themselves. And while that's coming from external forces, for example, when you start to internalize that, that must be a horrible thing to think about as well. The service, receiving service, again, it's 40% of people are reporting overall. So these are very large numbers of people. So if we're thinking 40% in Victoria, that's 400 out of that 1,000 are saying that their service is much worse than other people. People being afraid of you. So we all know the tropes around angry Aboriginal man and angry black woman, those sorts of things. So they're wide and alive to this day. 42% of people are reporting that's happened to them. Being yelled at, insulted, called, a lot of those names that we don't like. Again, 35% of people are reporting that. So these are not trivial things that are going on. One of my personal favourites, if I can be a little bit facetious, being watched more closely than others at work or school, because apparently we're incapable of performing our duties at work or, in the school environment. It's 30% of people. So I just want to highlight some of these, the prevalence of these things, whether it's Victoria, whether it's WA. It's higher in some places than others. And then the one which we know has significant impact, and we've alluded to it a couple of times, police unfairly bothering or intimidating me. 25% of all Aboriginal and Torres Strait Islander people in the Maikai study said that they'd had that engagement with police, 1/4. When we go down and look at, well, who is being unfairly bothered by police or interacting with them? Young men. People in the Northern Territory. There's things going on at the moment. So 70% of young men are reporting across the country this interaction with police. And we know that some of those interactions can get quite dangerous. So I guess I'm just impressing upon you the seriousness of some of these interactions. And while they are interpersonal racism, they're not structural. Therefore, my estimation is that these are underreported.
Yeah, I would agree with underreporting. And the outcome on a person would be for if they were. What would the outcome for somebody, say an Aboriginal young man who's had all of these? And what would the outcome for him?
I can't talk to necessarily. I'd need to pull it apart separately for young Aboriginal men.
Well, just in general.
In general.
On an Aboriginal person.
So what we see with this is significant increases across what we call the social determinants, so lack of opportunity in terms of finances, employment, those sorts of things. So engagement in that economy declines by over 50%. It contributes to unemployment, poverty. If we look at clinical outcomes, so high blood pressure, a 50% increase in reporting of high blood pressure, for example. If we look at cultural wellbeing, which we've also analysed in this sample, it increases people's sense of isolation, disconnection, the very things racism is designed to do, by over 100%. So
investment in rejuvenation of culture, not just an add-on of cultural activities.
That's right. Yeah, if we're trying to reverse or buffer against these things, we have to say, you would be able to say now that cultural engagement, participation, revitalisation remains as a key element to buffering against what's currently going on for people, clearly. But again, if we're wanting to create equity, we need to boost investment in these things that are protective, while eliminating the other things, right? We need to do both. It's not all on Aboriginal and Torres Strait Islander people to fix this. In fact, it's not our job to fix it. Our job is to advise you how to fix it, and the state's responsibility is to resource it, because we know what has happened in the past around resourcing for Aboriginal communities and families, or a lack thereof.
I want to reiterate a point that you made earlier, but just more broadly about our people's level of engagement, but also seen as professionals and so forth. And you've come before us today, and rightfully so, incredibly articulate and across your research. And the point that I'm trying to emphasise here is that this is not your gut feel. This is research and evidence. So for people particularly listening in, I think it's a really important point to make, that this is backed up by facts and research.
Yeah, well, we keep emphasising, my expertise as an epidemiologist. I just also happen to be an Aboriginal person that thinks from this perspective. which is good research practice, actually, if we really think about what research needs. We've done the hard work. We've done the development work over 4 to 5 years with community all over the country. And as a result, the engagement of, these are large numbers of people. We're not talking about small effects. We're talking about very large effects of exposure to racism and settler colonial risk. The data reflect that. But I will know, the commentary will come, that I'm biased, because you can't be an insider doing insider research, apparently. You have to have an external non-Indigenous anthropologist telling you.
What's your answer to that?
Run the analysis that I've run, the way I've run it, and see if you get a different result. The data's available. As a scientist, I'm obligated to make our data available for analysis. I will not make it public because this is the stories of over 10,000 Aboriginal and Torres Strait Islander people that have entrusted this data to me, and there's a process to go through if you want to analyse the microarray data, but it's open for anyone to put forward an application to analyse any of the data.
You've mentioned 2 features that were important in terms of progress towards health equity. One is the investment in protective systems, and the other is elimination of what I might call adverse features, including racism. So what are the features of an anti-racism system or a pathway towards health equity?
Anti-racism frameworks are really important for systems, I believe. There's been very limited work done on that as well. We recommend using systems dynamics. It's a particular field of science that looks at systems and how they manifest and how they reinforce each other, to undertake mapping exercises to see how systems reinforce racist behaviour, but also where you can break systems to stop that. And then you can develop maps and diagrams that show, well, if you intervene in certain points in the cycle or the system, where those points of inflection might be. And then you create loops that are reinforcing, that keeps the system operating. So I'm familiar with some in the health systems because that's where I primarily work. But when you're looking at features, so you need to conduct the mapping of the system to identify what's currently going on, where those points of inflection are. You need to then design an ideal system. So the accountability mechanisms are a very important part of that. So where a clinician, for example, has enacted racism in their clinical service delivery, who do they report to? At the moment, or who reports them? At the moment, it might be another health professional or the client. Where do those people report to if they want to make a complaint about their treatment? It is often into this system that is designed to protect the system itself, not necessarily the client. So there has to be independent mechanisms for investigations that are external to the entity being investigated. In terms of health systems, but more broadly other systems, we're talking about there's client satisfaction surveys and staff surveys that go on in very large health systems every year. Embedding questions on racist experiences of healthcare, for example, is a really good start for your client satisfaction surveys, so that you're getting information about where things are occurring, that they can be anonymous for clients. And so you can pinpoint either areas of concern or areas for action in investigation. So I'm not aware of any system in Australia that has that. We've been recommending that whole investigation process and accountability process sit within, say, critical incident areas, because that's what they are and that's how they ultimately manifest. usually in the death of a client. And so what we need to do is make sure that those systems are independent and robust, and have a high level of Indigenous engagement. If they don't, then the system is designed to protect itself, as I keep saying. So it will keep protecting itself. I think that's where we can start with health systems. It's nice that racism is being acknowledged as a contributor to poor outcomes. As a colleague of mine says, they should also be enacting the recommendations of investigations. So sure, we can make apologies. How about we just get down to embedding what the recommendations from coronial inquests and other things say that systems have to do as well. We can apologise, but we need to do as well.
So you've mentioned the need for the research or the data and the identification of where experiences of racism are and where they're occurring. Do we need to also anticipate that the system will protect itself?
Yeah, absolutely.
So how do we do that work?
Yeah, so one of the things that in the health system is also very important is if you're a health practitioner, you have a piece of legislation that you have to abide by. You have a regulatory framework for your profession. Every year, you usually pay a registration fee for that. And as has happened in one instance that I'm aware of, being deregistered as a profession has a profound impact. So if we are going to get...
Or is that deregistration of a clinician or an institution?
A clinician. Also losing your accreditation that all health systems are bound by can have a profound impact on that health system. I think if we are going to talk about serious doing, then these are the types of things we have to be talking about. The Australian Health Practitioner Regulatory Authority is already making moves in this space, that if you're not providing culturally competent care, there can be actions against you for not providing that care. The same moves are also occurring in the health system more broadly around accreditation. There are requirements of hospitals and health services, for example, that require them to be culturally competent and to be meeting certain obligations under their obligations to Aboriginal and Torres Strait Islander care processes. So
are the colleges moving with these programs too?
Well, I mean, the colleges, some are, some aren't, but again, some of the colleges are advocacy groups as well. And again, to design to, will protect themselves. So, it's a bit like asking, the perpetrator to design the solution, if we're going to get serious about it.
Commissioners have further questions? Yeah.
No, but I just want to thank you a lot. I think you've put a lot in perspective and a lot to think about, and probably rethinking about some evidence we've heard in a different light, I would say. So I just really want to thank you, one, for coming along and sharing this with us, but also a bit of an educational piece, I think, for people listening, or we'll get people to listen back. So thank you for all the work you do.
Thanks for, often we, publish, in a university, you're expected to publish papers, and apparently that's how we impact change. I want to thank you for the opportunity to speak to the work that we do, because I think the work that you're doing and the evidence, hopefully, that I've given goes some way to impact change. Yeah.
You've talked a little bit about this. I wanted to open up to, what does self-determination look like in the health system context?
I think if I was to think about self-determination, but if I had the ability to design or make decisions about how a health service operated, I would think about, sure, we need to receive that really good clinical care, which is evidence-based at the same level as anyone else. But I would also want to feel that I could be, who I am as a person in that environment, in that process. So if we're designing a system that's truly self-determining, it's about the very essence of who you are as a person or a people, and how you see yourself in that system. And unfortunately, for many of us, in these, whether we're engaged, work at a university, or in a health service, it is sometimes very hard for us to see ourselves and how we want to be in this world in those places at that time. Now, that acknowledges that over history, that's been much harder for people. Maybe a little bit different today, but there are still these very real challenges that we face. So I guess for me, that's what that would be.
And around accountability. So we've heard a lot about lack of accountability. I talked about it a little bit earlier. What could you share any sort of further thoughts you had on system accountability?
Well, I mean, the accreditation standards are a really good accountability mechanism. Now, again, they've been designed in a certain way, so we would need to pull that apart a little bit more. And it goes back to my point before about, what self-determination for an Aboriginal person in those systems looks like. And I think we need to start from there. And then once we figure out what those things look like in a system, we embed them in the accreditation standards. So whether that's for Aboriginal people, whether that's for other groups as well, we need to make sure that how we want to be in that system is reflected in the system itself. And if that's not being met, of course, you have to have the resources to do that within a system. But then if it's not being met, how do you hold that system to account? Now, if it's, there are scales of accountability, right? From, okay, there was an obvious oversight or some issue that wasn't enacted, through to a terrible outcome, and everything in between. So there has to be responses that are commensurate with those differing levels.
Yeah, and I asked in the context of we're making recommendations back to government, but also the First Peoples Assembly to negotiate through treaty.
Yep.
So just thinking about that systematic accountability.
Yeah. Well, there has to be, we see it with Closing the Gap at the moment, around joint council, around endorsing Closing the Gap. There is still this situation where governments feel they need to manage our affairs. I see it. I can't talk to the evidence of it. Well, I can actually. We do ask a question around, government involvement in community affairs. I don't have that at hand, but it's reported quite commonly in my QI. So and I'm talking to 3 Aboriginal commissioners. So while we might be at the top in terms of that ultimate authority, there is still a non-Indigenous managerialism under us. And it concerns me. I'm becoming more concerned about that. So instead of non-Indigenous people being the arbiters of our decision-making processes, being at that top level, there is now another perverse way this is occurring through professional management of us managing up. And I'm very deeply concerned about this going on. So that's just a personal reflection, but I think that's a serious issue that settler colonial ways morph very subtly. And so while we might be sitting at the table, there's things going on below us that are continually trying to keep us in check And I think we need to really keep an eye on that as well.
And this question is about your journey. And you would have heard, you've talked a lot about the data around systemic racism and the work that you're doing. If you feel comfortable, would you share some of the I guess, the barriers that you've had to push through on your professional journey with us, only if you feel comfortable?
Yeah, some of it not so comfortable, some comfortable. I guess the tyranny of low expectation at school was ever present. The naughty, not so naughty child, but naughty. Those sorts of things. University system has been interesting, shall we say, as one of the ultimate settler colonial institutions that is still alive, thriving and kicking today. I get the sense, which is why I highlighted the watched more closely than others at work. I've got 4 degrees to compensate for an internalized lack of something, which is perpetuated on me, but also, that broader society expectation of low achievement. I spent 12 years at university, trying to combat something that's not real. But that's a personal reflection more than anything. I'm a product of settler colonialism. Like, grandmother, stolen generation, Cootamundra Girls' Home in New South Wales. Very fortunate that she was able to reconnect with family. She's no longer with us, but sorry. She's the person that I look to the most in terms of what I do every day. There's a photo I have sitting on my desk of her and my oldest brother, who was also removed, as the thing that keeps, in a really sick way, my fire alight, and why I do the work that I do. So, these systems have tried, have failed in terms of my own personal experience, but I'm acutely aware every day that we've got an absolute long way to go. And I hope to be part of it for a lot longer.
Last question was, and you just talked about it, which was, what inspires you for the future?
My 15-year-old son. Some of the experiences I've talked to today, he's already witnessed, unfortunately. And I want to see a future for him where he's free to be who he wants to be proud of where he comes from, proud of his heritage, free to practice his culture unencumbered, and that the rest of society values that. That might be a pipe dream, but I'd love to have that for him.
That's it. Can I just say on that point that most of the parents that have sat over there that are Aboriginal or Torres Strait Islander have said a very similar thing. And I think it's really important that we acknowledge we do as Aboriginal people to better the next generation, so they don't have to. And your work just points to that, of what we need to do, differently. Thank you for sharing that too.
Thank you. Thank you so much. And from my perspective, when you're talking about who you are just then and your dedication to your grandmother, it's very strong for me.
Yep. She was a fighter. I, in some small way, hope to emulate a tiny fraction of what she did. Yeah.
Thank you very much. That reminds me that I was remiss, if we finished council, not to acknowledge the absence of Commissioner North today because he's ill. I just want to put that on the record. It wasn't in my script, so I've remembered while we've been
And Commissioner Walter too, yes.
Commissioner Walter, I gave the
Like,
apology for her for the week
Mm.
yesterday. Thank you.
thank you, Ray, and thank you for the wisdom and personal insight that you brought as well.
Thank you.
Commissioner, is that an appropriate time for a break of approximately 15 minutes while we set up for the next panel?
We'll now adjourn. Yes, gosh, it's almost time again. Yes, we adjourn until the next session, which say 15 minutes, 11:30, should we say? Are we ready?
For guidance there, 11:30, is that all right? Yeah, yes,
Yes,
thank you.
just to be realistic. Thank you. believe we're ready to resume council. If I could also just, in welcoming the co-chairs, I just need to reiterate that we are missing Commissioner Walter and Commissioners Hunter. Both are not well.
Commissioner Walter and Commissioner North.
Commissioner North, sorry. Oh, sorry, what did I say? Sorry, Sue Ann, how did I do that? So Commissioners Walter and North absent due to illness.
Thank you, Chair. I might announce my appearance. My name is McAvoy. I appear as co-senior counsel assisting the Commission for the purpose of these witnesses. We also have at the bar table Ms. Ngarra on behalf of the People's Assembly of Victoria, and it might be appropriate that she announces her appearance as well.
If it pleases the Commission, Ms. Ngarra, appearing for the First People's Assembly of Victoria.
Thank you, Chair. As you're aware, Chair, that the witnesses this morning on behalf of the First People's Assembly of Victoria are the co-chairs, Ngarra Murray and Rueben Berg. I propose to have them sworn in at this time. I can indicate that we intend to break at 1 p.m. and I would ask the Commissioners to consider a 30-minute break in an attempt to finish at or about 2:30 this afternoon as scheduled. And we will deal with that at the appropriate time, Chair, if that's suitable.
Okay. Thank you, Councillor.
And the other matter I might indicate is that Mr. Berg has some opening remarks that he wishes to make once we've proceeded with the swearing-in process, which I'll proceed to now. Ngarra, could you tell the Commissioners your full name, please?
Yeah, it's Ngarra Murray.
And in the evidence that you were about to give the Commission, do you undertake to tell the truth?
Yes.
I'll just turn to Rueben. Rueben, could you just tell the Commission your full name, please?
Rueben James Hamilton Berg.
And in the evidence that you're about to give to this Commission of Inquiry, do you undertake to tell the truth?
I do.
Thank you. Now, Commissioners, there are two submissions from the First People's Assembly of Victoria, which will be tendered in due course. The first submission relates to education, health and housing, and the second in relation to economic independence. I will now invite Mr. Berg to make his opening comments.
Nyata, Nyatuk Gunitmara, Nyatuk Kiwarong, Nyatuk Japarong, Nyatuk Wurma, Nyatuk Parabina, Linya Miring Thanyang Punat, Wanyung Rundri Miring, Todo Rundri Linya, Todo Rundri Cocoon. I began then by acknowledging the traditional owners of country that we meet on here, the Rundri peoples, and I pay my respects to their elders past and present. Like so many traditional owners across this magnificent place, today known as Victoria, the Wurundjeri have done an amazing job keeping the flame of their traditions, knowledge, language and wisdom burning. Despite some pretty overwhelming and harrowing odds, these treasures have been preserved and will continue to be handed down to future generations. And thanks to this, it also means that everyone who now calls Victoria home, or even visitors passing by, can learn about and connect with the oldest living cultures in the world. I hope everyone can recognise what a gift that is. Now, the topics of this hearing, health, education, housing and economic life, are of course incredibly important and all things that I know Treaty can help with. In a fair society, everyone should get a chance to get a good education, have somewhere to live and be able to provide for their families. But since invasion and colonisation, so many laws and policies have sought to actively exclude Aboriginal people from benefiting and getting ahead. We were driven from our lands, forbidden from using our languages, and burdened with economic disadvantages and obstacles that are still weighing us down today. The good news is we know that when we make sure Aboriginal people have the opportunity to make the decisions about our lives on our own terms, our communities thrive and everyone benefits. And that's what treaty is about. We know that when it comes to things like Aboriginal communities, Aboriginal languages, our sacred sites and land, Aboriginal cultures, that of course the experts are Aboriginal people. Community knows community. And we don't have to look any further than the fantastic work of the Aboriginal community-controlled sector to see that. The many ACCOs serving our communities in health, education and housing have a proud history of delivering excellent services and better results because they are run by and for our communities. They understand, respect and tailor to our cultures and communities. Heading into treaty negotiations with the Victorian Government in a few months' time, I know a key point we'll be hammering home is decisions about First Peoples should be made by First Peoples. We say this because it's the right approach on principle, nothing about us without us, but we also say it because we know from experience that it delivers better results. It's for these reasons we've created a treaty negotiation framework that will directly empower Aboriginal communities with the ability and tools to develop and deliver practical solutions at a local level. In contrast to the policies of yesterday that sought to exclude us from the economic benefits generated in Victoria, treaty will empower our communities to create wealth and prosperity for generations to come. Shared resources like the Self-Determination Fund that the Assembly negotiated with the Victorian Government to create will help in that process, and you'll have seen it as one of the topics of the Assembly's submission to this hearing. I'll be happy to answer any questions you might have for me on that and other topics here today. And I'll just wrap up by reminding the wider audience outside of this room, given it's Reconciliation Week, that First Peoples do want to get on with creating a better future together with everyone who calls Victoria home. But to do that, we have to do this work, like treaty, like truth-telling, to level the playing field so that we can do so as equals. Our people have faced unfair barriers for too long in economic life, in health, in housing and in education. So let's keep having the important conversations like this one and commit to doing things better. Thank you. Today.
Thank you, Rueben. Are you happy for me to call you Rueben?
Absolutely.
And Ngarra?
Mm-hmm.
As was said in the outset, there are written submissions that have been provided to this commission with respect to education, health and housing, and also with respect to economic life. I will take you to those submissions in due course, but I would like to try and put the submissions in some context in terms of the role that the First Peoples Assembly has in those areas. Firstly, can you just remind the commissioners, and I know it's been done before, remind the commissioners of the membership of the First Peoples Assembly?
Yes, so the Assembly has currently 32 members and looking to add, when it's provided to us, the 33rd member of the Assembly. And we're democratically elected First Peoples from this state. There's a process whereby we can have members elected within different regions. And there's also a process whereby recognised traditional owner groups, whether that's recognised by the state or recognised through our own self-determined process, that those recognised groups can appoint their own representatives as well. And that brings us to the 33 members of the First Peoples Assembly of Victoria.
Thank you. Now, the mandate or the function of the First Peoples Assembly of Victoria, can you just describe that for the commissioners, please?
Absolutely. So in this second term of the Assembly, we see that it is now our role, and it is our role, to progress treaty negotiations with the state for statewide treaty outcomes. That is the role of the First Peoples Assembly of Victoria.
And it's obvious that First Peoples Assembly of Victoria is a relatively new institution within the Victorian First Peoples communities.
That's correct. So we were first established in 2019.
And in respect of these topics that the commissioners are looking at now, health, housing, education, there is a considerable wealth of knowledge and experience within the Aboriginal community organisations who have been operating in these fields for decades. You would agree with that?
Absolutely.
And indeed, in your opening remarks, you made comment about that wealth of knowledge and experience. Many of those Aboriginal community-controlled organisations have or will give evidence in this hearing block on their specialist subjects. Given that they are making submissions themselves and giving evidence, I'm just wondering if you could give the Commissioner some guidance as to how the Assembly's submissions ought to be viewed in light of that specialist advice.
Yes, I think from an Assembly perspective, our focus, as is our role, is to understand how a lot of the recommendations that will come from Yoorrook, which are going to be fed by the expertise of our community experts and by community themselves directly, how that fits into the broader treaty landscape and the broader treaty picture. But I think it's critical to recognise that the 33 members of the Assembly that sit around chamber, we don't say that we're there as the experts on any particular field. We're there to represent our communities and to progress treaty outcomes. And we're going to need to draw from and work in partnership with all of our experts, whether that's with traditional owner groups, whether that's with ACOs, whether that's directly with other community organisations and individuals. We need to draw from the wealth of expertise from our communities so that we get the best outcome.
And having asked that question and heard your answer, that's not to say that the members of the Assembly are not members of their own communities and bring with them their lifetime of knowledge and experience to assist the Assembly to form its own views.
Absolutely. And I think one of the roles of the Assembly is to look at the big picture of everything that we're hearing from all the different expertise and draw from our own individual experiences to work out what the best path is, drawing from all that expertise that comes from the various areas.
But it is the case, I think, from hearing both evidence from the Aboriginal community-controlled organisations and from the government that there is some intention to attempt to deal in some additional sense or greater depth in some of these issues or all of them in the treaty context. Is that your understanding?
Yeah, so as we progress, the idea from our perspective around treaties is not to just have one single treaty at a statewide level, it's to have ongoing progressive treaties. And the current focus is what that kind of systemic issue, how do we change the entire system and create a new system, and then continue to add on to those treaty conversations on particular subject areas, where we'll of course be leaning heavily on the expertise about those areas from our community.
Thank you. Now, I want to turn to that part of your first submission that deals with education. I'll ask the operator to bring up page 17 of that submission. You have your submission in front of you?
I do.
Can you see the portion of your submission which reads colonisation has had and continues to have? Are you able to read that into the record, please?
Yep, the first paragraph or both?
Both, thanks.
Yep, no worries. Colonisation has had and continues to have a significant impact on First Peoples education. Until recently, education was used as a tool for forced assimilation and cultural genocide. Children were forcibly removed from their homes, and despite the promise of education, were often trained in farm work or domestic service and used as a source of cheap labour, amongst other abusive practices. The Bringing Them Home report, 1997, provides further invaluable insights into the struggles thousands of First Peoples faced during and since forced removals were mandated. The transmission and preservation of First Peoples cultures, languages and practices was actively discouraged and punished. The impacts of these colonial practices continue to be felt today, and there remains persistent disparities with respect to educational access, retention and achievement.
Thank you. Now, this commission has heard evidence from witnesses that they or their parents who have lived particularly on Aboriginal reserves were only permitted to attend school to grade 3, 4. It never passed primary school. Are you aware of those racially discriminatory practices?
I am.
And are you aware yourself of individuals or communities that have had that form of discriminatory practice exercised upon them. Do you wish to say something, Ngarra?
Yeah, I have a story of my grandmother, Nora, that went to school at Kamragunja. And she was only able to pursue her education to grade 3 on the mission. And she just really loved learning and really wanted to be educated. But unfortunately, she had to finish her education in grade 3. And then she tried to go to the Barmer School, which was across the river in Victoria. And they lined up all the black kids and they lifted up their shirts to check the colour of their skin on their backs. And she was too black to go to Barmer public school. So she unfortunately from there ended her educational journey and then went into, domestic duties as a child and eventually would be part of the Kamragunja walk-off. But I often think of that story of my nan, and I've told my own daughter who's in grade 3 now that story, and she gets really, sad and can't believe that would actually happen to someone of the age of 8 or 9 years old. So those are real stories that we have and are very familiar probably across all our families of our grandparents that, grew up on the mission and went to school. So that was a huge disruption to her education, and she ended up on a lifelong journey of educating herself pretty much. But I think back to that little girl on the Camera mission and many other kids too that she grew up with and that are still alive today that were, finishing up their education at primary school age.
I want to ask you a question about your observations or knowledge about your communities. Does that discriminatory practice against allowing Aboriginal people to engage in the fullness of the education system, has that had any effect on the way communities might view the Western education system now?
I think 100% it does. And I think it's not something that the broader community has a chance to really reflect on and understand, because I think for a lot of the broader community, when they think about schooling, they'll look at a school and think, oh yeah, that's a place that you want to be a part of. That's a place where, their parents, their grandparents went to school, where there's lots of other kids who are just like them, where there's the teachers who are just like them. School just seems like a comfortable place that you would want to send your family when you're looking at it from a non-Aboriginal perspective. And I think there needs to be that understanding that when you look at it from the Aboriginal community's perspective, those perceptions are often vastly different. That when you're thinking about a place that there's very few of your community actually there are very few teachers, absolutely, and the curriculum isn't actually reflecting your history properly, that you've got family history of those places being places that they were deliberately excluded from, just the how our communities perceive education and schools themselves is vastly different. And those perceptions have an impact on how you go about living your daily life. That if you don't grow up where it's just assumed that you'll go to school and you're going to feel welcome and safe, that has a significant impact on ongoing education outcomes today.
One other of a number of impacts that are reported from community members is and is often repeated within community is that in many cases First Peoples are the most well-trained people in the country because of all the courses that First Peoples do, but that they don't result in any employment. And so the value of education is viewed as perhaps less than it might be for the broader community. Is that part of your experience?
Absolutely. Actually, I used to work for the Department of Employment and Workplace Relations, and there were programs set up to ensure that you could get First Peoples through training. And a lot of times it was sadly just seen as a way for organisations to just get some quick cash in the door by running some First Peoples through training. And then we'd see the same people go to another lot of organisation for a different set of training. And it was just a constant cycle of being put through training, but no actual jobs at the end of it. And that can be very disheartening to think you've gone to all this effort to do this training and then you're just told to go off and do another set of training. That can have a significant impact. So,
you're saying people ask themselves, well, what's the value in going through all the training and education if there's no work?
Absolutely.
And the lack of the failure to obtain work is what are the causes of that to your mind, having worked in that industry or government sector?
There's no simple one answer for this, and I think there's lots of other expertise around it, but I think there is still that direct racism about employment outcomes for First Peoples, but there's also just that indirect racism or that unconscious bias that if someone has sitting in front of them for a job interview, someone who they can relate to, as if they're a non-Aboriginal person doing the interview, they've got someone sitting there that they can relate to, they understand, they have similar shared experiences, and they have another option of an Aboriginal person who they might not have the same shared understanding of. They might have preconceived biases about this Aboriginal person. They're more likely to pick the non-Aboriginal person as the person they employ. And that's just the sad reality of the things that we still see happening today.
One other aspect I just want to explore with you briefly is the value that appears to be placed upon Aboriginal knowledge and experience in the mainstream educational institutions. And we will hear evidence about this from other witnesses later, but is there any comment you can make about how that impacts on people's desire to go through Western education systems?
Yeah, I think it is improving. There's still a lot of work to be done. But if you think about for generations of our community, they've been going to school, and if there was anything they were taught about Aboriginal people, it was just negative stuff, that we were worthless, kind of that was the sort of narrative that we were being taught at school. There is this shift happening, and it needs to be happening more to get better education across the sector, across community, to understand and draw from that Aboriginal knowledge with appropriate respect and recognition of that. But it has been an ongoing issue for a long time, that the education system hasn't provided a positive outlook on First Peoples. It is changing and there is positive work happening, but there still is a lot that needs to be done.
So following on from the section of your submissions I took you to earlier, there's a further heading, Education and Treaty, and I might just read to you some of the submission and then ask you some questions. It reads, ACCOs have and continue to play an important role, and ACCOs is, of course, Aboriginal community-controlled organisations, have and continue to play an important role in providing culturally appropriate and responsive education services to First Peoples in Victoria. Despite ACCOs often achieving better outcomes in education than mainstream services, they do not operate on equal footing with mainstream organisations and remain severely under-resourced. The lack of investment in ACCOs to deliver strong educational outcomes for First Peoples is exacerbated by an education system that is based on a colonial education system. Despite the Victorian government's commitment to self-determination, it is not doing enough to ensure First Peoples in Victoria receive culturally appropriate, safe education. A culturally appropriate and safe education. Systemic change to the education system is required to ensure that it is available, accessible, and appropriate for all First Peoples. Treaty is required to give effect to genuine self-determination and address the current injustices in the education system. First Peoples need to be afforded the opportunity to decolonise, redesign, and reclaim an education system that has historically been used against them as a tool of assimilation and oppression. Those words speak of substantial change to the education system. That's what's intended, I'm sure.
Correct.
A big part of that substantial change, I would suggest to you, is the issue of cultural safety in schools. Is there any further detail you might want to share with the commissioners about your view of the need for cultural safety in schools for students?
Nothing too more detailed to add, just that it's obviously so critical that Aboriginal kids can feel safe and comfortable at schools. And I mentioned before that the perceptions for the broader community is there is that level of comfort to know you're sending your child to a school with other children who are similar to them, with teachers who are similar to them, who understand how they go about living their lives, that when you're coming from a different culture as the First Peoples, there's not that automatic understanding. There's not that shared sense of connection to other students and that shared respect and understanding of your culture. That I think there's still such a lack of understanding of what our cultures are, and there's still this stigma that hangs over First Peoples that we need to continue to work to eliminate that. And so that's why changes like that are so critical.
Do you have anything to add, Ngarra?
Yeah, maybe just an example of a good little school out in Thornbury. Thornbury Primary School has a big population of Aboriginal kids, and they all learn Wurundjeri Woiwurrung language, and it benefits the whole school. So all the kids learn it, and it's really built unity and strength and an identity for the school, and culture is really embedded in that school. And it's quite a small school, but I feel that everyone benefits from the learning of Wurundjeri Woiwurrung language, and it's spoken by the teachers. All the kids, they sing in language in songs, and it's a holistic approach to the cultural journey that all kids have at that little primary school. So I think just wanted to share that example of what they're doing out there in the northern suburbs, where we do have a high population of kids in the primary school, and it's a real cohesive collective unity that they've built throughout the school. They even wear their Aboriginal NAIDOC shirts as their uniform. So it's like a really proper school where culture is key to kind of their learning and their foundation.
It's I can tell by the way in which you've spoken about it that you feel that it's a good program and a good school. Is that type of cultural safety, the embracing of cultural safety in that way, something that should only be done at schools with high population of Aboriginal kids, or is it something that ought to be available to kids across Victoria?
I think it should be available to kids across Victoria, and it's a really unique example. There's not many schools that are actually like that in Melbourne, but I feel that that should be embedded across the curriculum right across the state.
And there's benefit to the school and the other students from their knowledge.
Absolutely, and to the families that have their children at the school. It's been amazing to see. I've been part of that school for my own children over, many years, and I've seen that school flourish in that sense around the cultural learnings that the children undertake in their everyday engagement with the school.
Now, you've spoken just now about the circumstances where there is a culturally safe environment for students. Is there, to your knowledge, any connection between a lack of cultural safety and or outcomes such as low attendance rates and poor academic outcomes?
I don't have any specific studies or statistics to refer to, but it would seem obvious to me that if a children doesn't feel culturally safe at school, they're much less likely to be attending as much as they should be, and they're much less likely to have that desire to succeed at school if it's a place where they're not feeling culturally safe. I think anyone who can put themselves in the position of a young Aboriginal child in that position would recognise that that's going to be a challenging environment.
And so we've heard from Ngarra just a moment ago about the steps that were taken at Thornbury Public School. Are there things that you are able to talk about here today that might ensure students in the formal educational setting get appropriate cultural safety, or is that something that really is a more detailed discussion?
Yeah, I think that's a more detailed discussion.
Mr. Beckerpool, can I are you aware that the child safe standards, the very first child safe standard of this state is that relevant entities establish a culturally safe environment, diverse and unique identities and experiences of Aboriginal children and young people are respected and valued? Do you think that's upheld in this state in schools as the first principle for standards for our kids?
No, I don't think so.
Okay. Sorry, Mr. Eck, I just wanted to bring that into the conversation.
Now, you are aware that in Victoria there is the Murrung Aboriginal Education Plan, which is adopted in 2016 and has a 10-year lifespan running till 2026. And so many of the issues that I'm now taking you to are dealt with within that framework. Is that correct?
Correct.
But I suppose there is opportunity for us today, without going into the detail of the Murrung plan, to note that there are a range of other what we might call intersectional issues that add to the problems caused by lack of cultural safety, including generally speaking, health, mental health, poverty, which all contribute to poor academic outcomes. You would agree with that?
Absolutely. And that's what I think is the challenge within this space, and why I think, despite oftentimes good intentions from the government, there isn't the capacity to get the outcomes, because you can't just focus on one particular area. There needs to be that tackled across all those areas. And I think too often what we're seeing is we're trying to solve the issue from kind of within the sandbox, within the structure, within the framework that already exists, rather than stepping back and saying, well, actually, if we're going to kind of reset this, how would you do it without being constrained by that existing sandbox? And I think that's the opportunity that treaty provides us.
Yes. Yes. So, notwithstanding the work that has already been done, and the adoption of the Murrung plan, you include some statistics at page 18 of the your written submissions about educational outcomes continuing to be comparatively worse for First Peoples, despite some improvement in some areas. So, in that part of your submission, you note that First Peoples children were 1.45 times more likely to experience bullying than they were a year ago. That 34.2% of First Peoples children commencing school were assessed as being developmentally on track, compared with 57.7% of non-Indigenous children. They are stark figures, and those figures they come from the Victorian Aboriginal Affairs report, the annual report for 2022. That's correct?
Correct.
72.6% of First Peoples aged between 20 and 24 had attained a Year 12 or equivalent qualification, but compared with 91.1% of non-Indigenous people in the same age group. 47% of First Peoples aged 25 to 34 years had completed non-school qualifications of Certificate 3 or above, compared to 75.9% of non-Indigenous people in the same age group. 58% of First Peoples aged 15 to 24 years were fully engaged in employment, educational training, compared to 79.9% of non-Indigenous people in the same age group. When the disparity exists in engagement in employment at such a wide level, that flows through to all of the other issues that we've spoken about. Would you agree with that?
Yes, absolutely.
And the final figure that you've cited in your submission is that the number of education workers who identify as Aboriginal has fallen from 247 to 209 between 2021 and 2022. These figures are drawn from the Victorian Aboriginal Affairs report, and they are figures that exist notwithstanding that we're in the second iteration of the Close the Gap process, and education has been closing the gap in the education outcomes has been a target since the commencement of the Closing the Gap process. So the fact that there hasn't been the ability to bring about parity in many of these areas, does that raise concerns for the Assembly?
It does, absolutely. And I think there's a strange paradox with all of that, though, because obviously, you know, from any community perspective, I would hope we want to see these discrepancies addressed as soon as possible. But I think we need to be mindful that it's been generations and generations and generations of barriers and exclusion, deliberate exclusion by government that has led to these discrepancies. So it would be kind of naive to expect that those discrepancies would be addressed overnight. That doesn't mean we shouldn't be doing significant work to get those outcomes. But if you look at the early childhood numbers, where we've seen good increases in that space, that's really positive. But the long-term impacts of that are going to be generations away, because that means that right now there's more kids going to primary school and early years education, which means in 10 years, there's going to be more kids who finish school, which means in another 20 years after that, there's going to be more kids going to school whose parents finish school. And it will become a more ingrained thing that this is what our family has done. We have gone to school and we've finished, and we're more likely to do that as well. But that's generational change that we're talking about. So I think sometimes I'm concerned that because we have these targets, that if government starts seeing that things aren't quite working, often there's been good direction about what should be put in place. But if government is too short-sighted on when it thinks the outcome should be achieved, they're more likely to dismiss programs and say, well, this hasn't worked because overnight we haven't seen a difference. And we want to make sure we have a longer-term vision about what we're going to do, and that we're tackling it at a system-wide level so that we can actually see those benefits across generations. And obviously we want the outcomes as quickly as possible, but I think there needs to be some realism about it's taken generations to cause these concerns. It might take us a little while to address them, and we need to be entrusted to be able to go down that path.
How do you balance that with the impatience in the community for change?
Yeah, that's the challenge. And so we need to be putting in whatever initiatives we can to try and address that, but we also need to be realistic and pragmatic about how quickly we're going to see those things, because we all recognise that these discrepancies aren't because of one particular thing. If it was, I feel confident we would have gone and fixed that one particular thing. It's because it's a multitude of factors that all compound themselves. That's what makes this so challenging. And so we need to be realistic about the types of things we're going to need to do to change it, and continue every day to strive to make that little bit more extra difference, and that will compound to greater outcomes as well.
No doubt many of the discrepancies that continue to exist in the social outcomes for First Peoples have been historically embedded, and the challenge is to break away from the history of the issues and the interaction. But the evidence that this commission will be hearing over the next couple of weeks speaks to differential treatment for First Peoples in Victoria that appears very strongly and is acknowledged by the government to be a symptom of racial discrimination. And that's a matter that you've pointed to in your submissions. Is it the Assembly's view, or perhaps your own personal view, that racism continues to play a central role in the differential outcomes for First Peoples in Victoria?
It definitely does, but I'm always mindful when we have these sorts of conversations that we distinguish between the various shades of racism that do exist, because I still fear that sometimes within the broader community, when we say that racism is a factor, they only go to the extremes. They only think of this is because someone clearly says, I don't like Aboriginal people, so I'm not going to give you an education. And that still does occur, sadly, but that is not the majority of what our concern is. It's those smaller elements of racism. It's that unconscious bias. It's that paternalism, that thinking that we're going to try and protect Aboriginal people from themselves because we know best, It's those types of things that have the greater impact and are more widespread. And I do often fear that if we only kind of paint it as that extreme version of racism, some people would dismiss it because I think that's such a minor thing. And so I'm always very wary that we understand that full scope of what we mean by that racism, that unconscious bias, as part of that, so that we can really unpack it and see the full extent of it rather than just giving the opportunity for people to dismiss it, because I think it's just a far right extremist idea.
The reality is, though, that there, I would suggest to you, is that there remains a degree of a structural and institutional racism that permits decisions to be made by government which has a discriminatory effect, even though in some cases the decision maker might not even be aware of that discriminatory effect.
100% correct. Yep.
And so that speaks to the need to provide some deep education to the decision makers in particular about what structural racism is and how they might avoid bringing biases into their decision-making processes.
That's definitely one solution. The other solution is that they no longer be the decision makers.
But in broad areas such as education and health and housing, do you accept that there's always going to be some overlap between the service to the community in such a way that it needs to be continued to be service delivery by the government?
There will always be a role for government to play. Government can't wipe its hands of its responsibilities, absolutely. But it's wherever possible making sure that where there is decisions that need to be made directly about First Peoples, that we empower First Peoples to be the decision makers in that space. That's a much better solution than training up other people to understand First Peoples. First Peoples know about First Peoples already.
And I won't argue with you on that point, but I just I wonder whether the First Peoples Assembly has as part of its mandate advocacy against racism. Is that part of the Assembly's role?
Absolutely. Definitely, we see that as part of our role.
And are you aware that there are any of whether there are any coordinated government programs to reduce racism against First Peoples?
I'm aware more broadly of programs to address racism as a broader concept, and I think there does need to be more targeted focus specifically on First Peoples. I think there has been a recognition that the broader multicultural and other minority groups discussion is an important one, that there are different and distinct interests of First Peoples within that space that do need to be recognised.
So what you're pointing there to there is a distinction between racism in its general sense, more generalised form, as opposed to the peculiar type of colonial racism against people who've been dispossessed and
correct
remain dispossessed.
Correct.
We know from the evidence that has come before the Commission that there is work that goes into cultural awareness and cultural competency programs for government officers, and trainings made available. We know that the government has adopted self-determination for First Peoples as a key government policy, and it's been in place for almost 10 years now. And the existence of those programs and policy environments in themselves require people to become a bit more educated and have a deeper understanding of Aboriginal matters and Aboriginal people. Would you accept that proposition?
Would, yep.
Do you think that the government is still going through a learning curve in that regard?
Absolutely, there is still a learning curve. And I think part of the actual power of Yoorrook is being able to provide a more solid basis to actually build on that learning curve and add to that learning for both the state and the broader community. That I think oftentimes there was some uncertainty about exactly what the bedrock of truth was about what's happened to our peoples. And the fact that we have this process where we've been able to bring out ministers to actually give the evidence, that can be really powerful, because sometimes it feels like we can say it as First Peoples till we're blue in the face and it's not really heard. But the fact that we can actually now point to evidence of ministers stepping up and saying these things will be a very powerful tool to ensure that parts of government have that better understanding.
And it's the case, as with most matters, that some agencies perform better than others. I mean, this commission heard evidence, I think, from the Chief Commissioner of Police to the effect that some small fraction, perhaps 16% of the force, had taken up the option of cultural awareness training over a program that had been running for a number of years, and that doesn't speak to a high level of interest in attaining that particular type of knowledge. And whereas there are other agencies with much better record. Does that equate with your experience?
Yes, I absolutely agree that there are some areas where there's been better success than others, but across the board, there's still more work to be done.
And so who should lead that work, do you think?
I think the government needs to take a leadership role in saying this is not just something we want to do to tick a box. This is actually a critical thing to be doing. And I think it's the role of something like the Assembly to continue to advocate that and to continue to push and test and see how the government is actually performing against those things. Because I know that a lot of the policies and strategies that you would have seen as part of this process often indicate there's a need for that cultural awareness, that training, but it oftentimes isn't delivering at the rate that it should be. And so that's a role I think that we can play in having that accountability for government on those things. At page 19 of your submission, you make certain observations in relation to the Victorian Government's 2017 Racism in Victoria report. It was noted in the key findings of that report, you set out in your submissions, racism is damaging to both the mental and physical health of Victorians. That applies more so to First Peoples after centuries of differentiation and oppression. Would you agree with that proposition? I would.
Aboriginal Victorians and Victorians who speak a language other than English at home but are not of the Northern European or Northern American origin are most likely to experience racism. That's a proposition that you would agree with?
I would.
Or a finding. As socioeconomic status declines, experience of racism increases.
Mm-hmm.
That's a finding consistent with your own observations?
Yes.
What it is in effect saying is that the less powerful you are, the more likely you are to be the subject of racial discrimination. You agree with that?
I would agree with that.
Another finding is that Victorian adults who frequently experience racism are almost 5 times more likely than those who do not experience racism to have poor mental health. So the connection between mental health and the experiences of racism is strong, according to the findings of this report. Is that something that accords with your own observations of the community?
It does. And again, I think it's very important to distinguish the different levels and the grades of racism, that when we talk about these sorts of statistics, it's not necessarily someone coming up to someone and saying, I hate you because you're Aboriginal, like that level of overt racism, which does still happen. It's those small little things that people are doing as a result of recognising your Aboriginality, those sorts of things that add up. And I think it's really important to get that recognition that it's the spectre of racism, that when we as First Peoples walk down the street, we can't necessarily tell which are the people who actually are racist. Sometimes you can, but you don't always. And there's always that fear that the person you might just be talking to in the shop, they could be a racist person as well. And so you're always having to be often quite guarded because you're not quite sure which type of person you might be talking to. So even if you happen in your day to meet all the people who happen not to be racist, the very fact that there's that constant fear that we might have to deal with yet another racist person, and there's that sense of always checking, am I having to deal with another racist? Even if you don't come across a racist for that day, it still has impacted on you. And that's a really powerful element to be better understood, I think.
Do you think that trait of being on guard against the pain of discriminatory conduct from somebody is something that that might be inadvertently passed on to our children, or purposely taught to children in order to help them manage their own existence?
Absolutely.
So that the consequence is that young people and children are having to be taught how to manage their own cultural safety.
Yep.
It's you would agree that that's a fairly a very sad state of affairs, isn't it?
I would indeed. Yep.
It is, and I think it's because racism is rife in our lives. Like, it's in all aspects of our lives, whether it's in the health system, or am I going to apply for housing, or in the schools. It's in our everyday interactions. And I myself as a parent try to arm and skill up and get my children ready. Like, I worry about my son catching the train at times in the public transport system because of the way that he could be treated or targeted on his way home from work or wherever. So it is taxing on our health in all ways, and it's something that we deal with as Aboriginal people right across the country. That's how I feel about it.
Is it? This is a broader question, and you may or may not be able to answer it. But is it possible to reach a place where First Peoples in Victoria are safe and thriving without dealing with the racism issue?
That's what we're striving for. I think that's the goal. How obtainable that is in a short term or a long term, I'm not sure, but I don't want to get up in the morning if I have to concede that that's not a possibility.
So you're saying that that in your view, a state of affairs where the First Peoples of Victoria are thriving and are culturally strong is possible. Do you say that it's possible notwithstanding racial discrimination or racism, or do you say that there has to be more done to combat racism in order for those outcomes to be achieved?
It's not going to happen by itself. It's going to take a lot of work, and hopefully the burden of that work is carried by the broader community, and the Victorian government takes on the burden of that work, that it's not left, as it so often is, to First Peoples to carry that burden. But absolutely, that's my aspiration when I think about what treaty can achieve, and what I'm striving for is that our communities are thriving and that our culture is at the heart of our daily lives. And that's what we'll continue to push for. And we know it's not going to be a straightforward, simple path, but we need to make sure that we have that goal we're working towards and try and bring as many people as possible to carry the burden to help us get there.
But and I understand that your answer has in effect responded to this, but in order to be thriving and for culture to be at the heart of what you do, can't be worried about the racist responses of people around you. You can't permanently be on guard. The two things are incompatible, aren't they?
Yeah, that you're not thriving when you're having to be worried about those instances of racism on a daily basis.
So there's a commitment to self-determination from the Victorian government, and there's a lot of things happening. And then there's this the report from the 2017 report on racism in Victoria. Then there's the Murrung Aboriginal Education Plan, which talks about cultural safety and cultural learning. And then there's the Victorian Aboriginal Affairs Framework, and then a range of other programs and policies. But the question, I suppose, is whether those programs and policies have been enough to change the lives of First Peoples and deliver the education, an education that is equitable, responsible, and culturally appropriate. In your submissions, you've spoken to that particular question. You say the treaty offers a pathway for First Peoples and Victorian government to work together and make this systemic reform that's needed to holistically address the socio-economic issues facing First Peoples. So that in your the Assembly's view of the trajectory for First Peoples in Victoria, a treaty has the capacity to do those things that perhaps haven't been able to be achieved to date.
Correct.
And what is it that you say treaty brings that all of that action that's currently in place and has gone before or has failed to adequately deliver upon?
I think at its heart, it comes to that concept I was speaking about before, whereby a lot of times within these conversations at the moment, it's all set within the framework of the existing sandpit of how things operate. And we're trying to create a new way of looking at things that's not confined by that existing sandpit. And part of that, I think, stems from the fact that when we think about self-determination, what it actually means, empowering First Peoples to make decisions about things, the way government is currently structured, it's really limiting in how much it can enable that, because government has obligations at a higher level to be responsible for the decisions that it makes. It is ultimately accountable for the decisions it makes. So it really struggles with transferring that decision-making power whilst keeping its obligations, whilst managing risk. So the government is often concerned, I think, on saying, well, if we transfer those decision-making powers, but the government is still holding on to that risk, it does need to keep its tentacles hooked in there. We see treaties as an opportunity to create a new space where the government can confidently transfer decision-making powers and the risk so it can step back. And the government is not structured at the moment to be able to do that. And that's what keeps holding us back, is those little tendrils that keep digging into the work we're trying to do. By through treaty establishing a different way of doing business, that the government at the highest level can say, yes, we can actually transfer this decision-making power across and trust that it's going to happen, that the process itself means that First Peoples are now responsible for it and that the risk now sits with us. And that's a big burden for us to take on as First Peoples. But if we want the responsibility, we need to be prepared to take on that risk. And once we can establish that process, a mechanism by which government can truly transfer decision-making powers, then the rest will flow from there. But until we have that structure, that capability to actually move away from the way government currently operates and empower us to truly make our own decisions, we're still going to be stuck in that old sandbox. So this is what we're trying to do through treaties, create the space so government can truly transfer decision-making power and we can actually improve people's lives through that.
At the outset of your evidence today, the depth of specialist knowledge and experience held within the Aboriginal community controlled organisations was acknowledged, and the history of those organisations is well known, and they will be witnesses at this hearing block. Do you say that those organisations and the communities are ready to take on that responsibility and risk?
I think there's a distinction in my mind between setting up the structures that enable to take on those powers and responsibilities, and there's a separate process for saying we are now wanting to take over those power and responsibilities. So that's something we'll have to discuss and have lengthy conversations about and understand when is the right time to do that. But unless we actually have a structure capable of doing that, there's no point in talking about how we're going to do it. So they're not necessarily phased at the same time. And this is the conversation we need to have through this treaty process, is how do we identify the types of powers that we want to see held by First Peoples? And it's a separate conversation about when will those powers be transferred to First Peoples and in what capacity. So that's where we'll need to have those ongoing discussions.
So some of the witnesses that have come before the Commission have spoken about their individual First Nation holding the decision-making power and taking responsibility for their own communities. Is it the role of the Assembly to help those nations and groups of people become treaty ready and then implementation performance ready?
Absolutely. And to be clear, I was talking about the statewide outcomes when I spoke about the role of the Assembly for particular traditional owner groups. We hope that the work that we're doing sets a kind of a model, a precedent about how at a local level for traditional owner groups, a similar process can be enacted where they're also empowered to do that. And there will be significant support for groups to progress through that. Through this whole process, we're always very mindful of making sure we don't set ourselves up to fail. We need to make sure that we're going to succeed in this space. And by transferring over power and responsibilities to groups that aren't ready to exercise it, that will lead to not achieving outcomes. So we're very mindful of that.
In your submissions, there's a case study in relation to Northland Secondary College. The issues relating to the closure of Northland Secondary College are perhaps well known to members of the First Peoples communities in Victoria. The case study speaks for itself, and the commissioners have been able to read that. But what are there lessons that come from that case study that you think maybe could be pointed out to the commissioners and those listening?
Yeah, I think it's an incredible story of the fight to save Northland, and we've had a member articulate the story. So truth telling about education injustice and the closure of Northland in 1992. We also have a student here today that was part of that fight, along with many other people like Uncle Gary Foley and Uncle Robbie Thorpe, I think Auntie Deidre Bucks, Alistair and Lynn Thorpe, Uncle Alan Brown, Auntie Rio, Uncle Archie and Auntie Ruby, all as parents with kids at the school, were part of that fight under the Kennett government closing down the school. And it was a really exemplary model of Aboriginal education and having a population of Aboriginal kids there, which then went to the rebel school, which is talked to in the story. But yeah, I definitely think there was a unique Aboriginal education program that was part of the school with the dedicated Aboriginal educators they had. So it was a really successful model. And the way it was closed down, because it was a Koori school and known as a Koori school across the state, and then reopened in 95, and that was after a battle with the government and multiple court judgments. But there's a lot that we can learn around that model and having culturally embedded knowledges and practices within the school. And there'd be many more people that could talk to that story. And there's also a documentary film, a play that you can learn more about that fight. So that was just one example of public schools being closed down in the 90s. So yeah, I think it's over 30 years ago now that happened. And a lot of those kids have grown up. Maybe some didn't make it either on the way. But I think Lisa Thorpe Jr.'s here. She was part of that cohort of kids that come out of that school.
Could I ask a question here? I'd just like to ask both of you in the context of now and them, because you're both parents, kids at school. But on page 20 of your submission, you point out about Marang being, expecting that we need to have appropriate accountability mechanisms now, and that the ability to have an education system that's trustworthy and culturally appropriate is implied there. But there's also an implication that there's not much been delivered there to this point in the overall context. How do you relate to a system that's so, across the state? How do you deal with that frustration, that racism, and your concern, Ngarra, you were talking about worrying about a child just getting to school, let alone once we get there for a safe, cultural safety space that we're hoping will arise out of a good educational policy with the right ingredients and hopefully the involvement of our people from the outset. There's a bit of a disconnect in my mind about how that's all going to come out because of the time factor in relation to treaty space. So are there other structures that exist in education that can underpin at this point in time and help enable those policies to be upgraded, modernised in the context of where we are now? I know it's a big question, but it's a serious question because we know government is a big machine. Departments are huge in comparison to the resources we have.
Yeah, I think there's a lot of frustrations and challenges, but I know the Assembly, we really join in that long advocacy of our community control orgs around the specific reforms that's needed. So there are urgent reforms that are required now, but it's so massive, like we're unravelling a complex system, programs and policies that have been imposed on us. And I think it is a matter of urgency for our kids and for the cultural safety of our children within the system. And there's urgent reforms, obviously, that you'll probably hear from the education experts within this hearing. But I think that, there's a lot of work for us still to do and things that we can do now. And we've talked about in the interim, short term and long term, but it will take time. As I said, it is rife within the system, the cultural exclusion that our children face within, primary, secondary, even tertiary. Is there anything you wanted to add, Rueben?
I just say that we've seen again and again that there are these strategies that have been put in place across lots of different sectors, including Marung here for education. And they are strong strategies in most cases that have been developed with support from First Peoples as part of that. That doesn't mean they can't be strengthened, and hopefully in the future they are strengthened as well. But if government has these strategies already, whilst treaty is going to be a mechanism in the future to, as a broad concept, hold government accountable, it shouldn't take treaty for government to actually deliver on promises and strategies it already has. Government should be able to have a process to deliver on its actual strategies without the need for treaty, and they should be delivering on these strategies. Treaty is just a mechanism to continue to hold them account in the future, but that shouldn't prevent them from right now actually delivering on strategies that they've already committed to.
It shouldn't, but I noticed that, the date of the report about racism, 2017, before the pandemic, before First Peoples Assembly, these things, we've moved apace in some, attitudinal change, I think, in part. But will the department be able to, or the government be able to do that across the board? That's the big challenge, isn't it? And how's the Assembly going to manage that? Is there a tiered approach from, say, members who are engaged in education and training? Is there some possibility of changes in that space so that they're lifted up to meet the new era, if we could put it that way?
Yeah, I think we're open to looking into those sorts of options, but I look forward to when members of the education department come before yourselves to hear what they've got to say as well.
That's to come, yeah. Thank you.
Just in relation to the Northlands Secondary College case study, is there any sort of further insights you'd like to share on the detrimental impact and the trauma that would have caused those children, young people, given it was a secondary college, and the ongoing impacts that may have had on their lives?
Yeah, I don't want to speak on behalf of the Northland Collective, but obviously, it impacted a generation. And that's quite evident within the story that they tell around the fight and the movement. around even just the government cost-cutting measures, lack of recognition for culturally responsive education, the community and legal mobilisation that had to happen within the fight, and looking at educational autonomy and Indigenous rights within the education landscape. So I think that there was a lot within that fight. I would have loved to see some of the representation of that group appear within the hearing to tell that story. But there is, as I said, a film and play, a book to come around that story.
And you mentioned earlier about some of the people who didn't make it. My brother was one of them. There was a case study referred to yesterday from Annie Gallagher about Lawrence Lovett. And he is one of those former students that went to Northland Secondary College who didn't make it. So, it's really important that people understand that it impacts us all, no matter where we sit and where we're sitting and where we're advocating from and so forth. So I just, as we always say on this commission, and we reiterate particularly the government and bureaucrats, that these aren't numbers. These are our people's lives. Continually, we're hearing of deep traumatic stories and our people's lived experience as well. So I just wanted to, thank you for that. And also the Self-Determination Reform Framework of Government. I love this document because I think I refer to it every time, but the key enablers are prioritise culture, address trauma and support healing, address racism and promote cultural safety, and then ultimately transfer power and resources to communities, this is a government language. Can you share any insights around where government has done that in an educational setting? Beyond the school, which is great, and I want to give the shout out to that you did to Thornbury. It's great work that they're doing there, but where has that happened to date in Victoria?
Not my area of expertise across that, and I would hope that you ask those questions to the experts, and I'd be very interested to hear the answer, because my worry is that the answer is not often enough.
I think the reason why I asked that, and it's good to hear your response to that, because as we've heard many a times, generally the answer has been no. And if it was, we would all know about it. If there was true self-determination happening in our communities and in our societies, we would all know about it because it's a rarity. Thank you.
Commissioners, are there any other questions in relation to the education topic you might have?
Not at the moment.
Well, I might just ask a couple of questions which I had proposed to ask a little later, but they follow on from the questions from the chair, I think. We heard evidence yesterday from the co-chairs of Nawi and Maru. As you know, that is the body tasked with the role of representing the various community organisations whose areas of operation are touched on by the National Agreement on Closing the Gap. It was there, the co-chair's evidence that the government appeared to be waiting for treaty in terms of doing many of the things that would be done in the variety of areas that the Closing the Gap targets and the priority reforms touch upon. It was their evidence that the government could not wait for treaty and must get on with the delivery of their existing commitments under their Closing the Gap obligations. I take it from your answer to the chair that you agree with that view.
Definitely.
Is there observation about government seemingly deferring the implementation of matters or development of new responses to the treaty process something that you're aware of, or is it something that's consistent with what you understand to be occurring?
We consistently flag with the various levels of government that we have conversations with that it's not our expectation that the government holds off on critical things connected to closing the gap, critical things connected to a variety of different areas, that they should not be just deferring to treaty as a way of delaying on those things. There are some elements where if they're talking about new systemic reform that might need to happen, that's obviously something that needs to fall under the consideration of how treaty can work. But there are no limits of the number of things that government could already be doing and should be doing, particularly around closing the gap. There are clearly identified targets and actions within that. There's no reason why treaty should be something that's delaying any of those activities, and it wouldn't be something the Assembly would wish to have delayed in any way, shape or form.
Is it your experience that some of those treaty is being used as an excuse in some circumstances for delay?
We do. When we talk to members of our community, we often hear them saying we've had conversations with government and we're told that because of treaty, these certain initiatives can't progress. And whenever we hear that, we have communications with the people that we talk to on a regular basis to say that that's not our expectation of how things should be done.
So, much of the time in the evidence yesterday with the co-chairs and the CEO of Ngarra and Maru was spent talking about the difficulty of deep structural and cultural change in government and what steps might be taken to achieve that. You've talked about the way in which government might divest itself of responsibility and risk as one mechanism for it. Are there other ways that come to mind in which that are not already being done, which might help to expedite or perhaps embed the necessary cultural and structural change that's needed in government to ensure that matters are dealt with in a timely fashion, that they're dealt with in a culturally sensitive fashion, in a way that respects First Peoples?
Yeah, absolutely. So when we were speaking earlier about the idea of the decision-making powers transferred, there's only going to be particular scope whereby it is the decision-making powers that are directly transferred. There's going to be a whole raft of areas where, for various reasons, the government will still be a decision maker, whether that's a sole decision maker or a joint decision maker. The government won't be absolved of all its responsibilities. And so we're very mindful that as we move towards this treaty space, that there's clear mechanisms that are needed for holding government accountable for actually the delivery of their responsibilities, and a formal mechanism to also be able to provide direct advice to government about how we think First Peoples views and matters should be considered in how they conduct that business they're still responsible for. And that's a key function that we see as we move into that treaty landscape.
Thank you. Any questions on that response, Commissioners? No? I might then just turn to your submissions, the Assembly submissions in relation to health. Just so that Commissioners are aware, do either of you have a background in the health sector? No. That was my understanding. And so your observations here come from your involvement in community matters, your roles at the various positions you've held, and your current roles as co-chairs, as well as your life experience. In the submission at page 28, make the observation that health outcomes continue to be comparatively worse for First Peoples despite improvements in some areas. Does that cause you, that must cause you great concern?
Absolutely.
Notwithstanding all of the attention that is being paid to the improvement of First Peoples health in this state and across the country, with the Close the Gap strategies, the various strategies that are being undertaken in the various subsectors of the health environment, that still in some areas the outcomes are getting worse.
And even more troubling to think about that we don't have a control to compare to, that without those initiatives, it's very likely things would be even far worse, if that's even imaginable.
So one of those, you list out a number of examples. The first dot point is that First Peoples have a life expectancy approximately 10 years lower than non-Indigenous Australians. Nationally, Aboriginal and Torres Strait Islander males born in 2015 to 2017 are expected to live to 71.6 and females 75.6 years. Non-Indigenous males and females to 80.2 and 83.4 years respectively. So we are talking about substantial differences in life expectancy for First Peoples in Victoria still.
Correct.
Chronic disease is responsible for 64% of the disease burden of Aboriginal Australians, with presentations to Victorian hospital emergency departments by Aboriginal people double the rate for non-Aboriginal people.
Correct.
Now, we will hear evidence about some of the reasons why that rate may be as high as it is, and in part, I think some of the evidence will go to a reluctance of First Peoples to go to seek early treatment, resulting in emergency presentations rather than earlier treatment. Is that your understanding of one of the drivers of that high number?
There are many, but absolutely that's one of those, and it stems back to, this is a recurring theme across all these areas, is those perceptions of those institutions. That when you've got institutions like hospitals that were involved in the stolen generations, that where there's a concern that if you come there with children who aren't well, that there's a risk that you might lose your children because of that. When there's perceptions of hospitals being unsafe places, of unhealthy places, when there's an ongoing recurring sense that hospitals are just sick places where you go to die, that perpetuates itself because community becomes too concerned to go there because of that fear that it's a sick place, that if you go there, you'll end up dying, that you don't go and you stay away and you become so sick then that when you do end up having to go to hospital, it becomes a self-fulfilling prophecy. And that then just perpetuates. So those perceptions that are very different from the perceptions that might be had by the broader non-Aboriginal community, again, have a significant impact in these areas, alongside a multitude of other factors.
One of the factors that we heard evidence about in this commission during the child protection hearings was the growing prevalence of use of pre-born or pre-birth orders for removal of children, and the fact that they might be carried out at hospitals after in the postnatal period after birth. Are they the types of actions that you were just referring to that which would dissuade people from going to hospitals and doctors?
Yeah, and similar stories across generations, across decades.
The evidence of witnesses about those particular orders indicate that it's not just historical, but it's ongoing, and there's present day concern.
Absolutely.
The next dot point reveals that Aboriginal people are 2.4 times more likely to have a disability than non-Aboriginal people. The next, Aboriginal Victorians are approximately 4 times more likely to present at an emergency department for alcohol-related causes than non-Indigenous Victorians, and we will hear from community organisations involved in the alcohol and substance abuse areas later in these hearings. Rates of diabetes are three times higher in Aboriginal Victorians than in non-Aboriginal Victorians. Aboriginal people are around 3 times more likely to experience high or very high levels of psychological distress than non-Aboriginal Victorians. And the perhaps related statistic that self-harm emergency department admissions are 4 times the rate of non-Aboriginal Victorians. With respect to the last 2 dot points, it's understood that the evidence coming before the Commission may show that those mental health issues were hidden numbers in the past and have become more prevalent in recent years.
Mm.
The statistics, when read together, you would agree are alarming.
Mm.
Absolutely.
The inability to shift those figures speaks to deep structural problems in the health system. Would you agree with that assessment?
I believe so, but not just within the health system, because these are, again, all interrelated elements and they all compound one another. And that often a key factor amongst a lot of these statistics is social economic status. And so many of our community haven't had that chance to participate in the economy that leaves us in that lower social economic status without the levels of education we've already discussed. All those factors compound themselves. And even if it's just like 1.1% more, just 0.1% more than the broader community in one area, if it's the same in every other single area, that adds up and that compounds. And the reality is it's not 0.1% more, it's much more in each of those areas, but I don't think there's enough broader understanding about the compounding effect of all those things. It's not one little thing impacting on First Peoples. It's a multitude of things that have impacted us across generations that lead to those compounding effects. And that's why it is a challenge to address these things, because the expectation that we would just impact on those compounding matters is naive to think we can just solve that. But that doesn't mean we stop trying, and that doesn't mean we don't need urgent reform in these areas, but we need to be realistic and give the trust to First Peoples and the time and the capacity to address these in a way we think is going to be best.
Commissioners?
I'm glad you pointed that out, Rueben, because I was going to say, with the treaty process, there's a lot that makes our people physically and spiritually sick. Yeah, that disconnects us from who we are. And that's all those systems, that's education, health, the child protection system, corrections, all of those. So if we are, and it may be a big question and you may not be, how will treaty, I know they're not negotiated without being presumptuous, how's that going to help our people get well?
And I think it's important to not see that treaty is going to be the panacea that just solves everything magically. Treaty, I think, is going to enable us to have a powerful tool and powerful tools to actually leverage greater control of these matters, so that we can actually listen to our experts in the community and enact those things that our community experts are saying without needing the permission of government to enact those initiatives, and to determine our own processes of measuring success and have a much greater focus on preventative measures. I think sadly what we've heard too often is that it's only once you're hanging off the edge of the cliff that you can get the treatment you need. We want to stop people getting close to the cliff in any way, shape or form. And by reframing how we want to do these things with the control that treaty will enable us to have as First Peoples, that will lead to that success. But it won't happen overnight. None of this is going to happen overnight. But I will be much more confident on our journey when we have greater control over these things than I am at the moment.
So I'll just take you to page 30 of your submission, which follows on nicely from Commissioner Hunter's question. You make the observation that statewide treaty has the potential, a very important word in this sentence, has the potential to secure the structural reforms required to implement these policies, aspirations and goals. And traditional owner treaties will give First Peoples the chance to guide the development of culturally suitable solutions within their own communities. And I think that's in essence what you were saying to Commissioner to her question.
Correct.
Commissioners, I note the time. It had been suggested at the commencement of this session that we might take a 30-minute break if that's suitable to the commissioners. And that way we should finish at the scheduled time of 2:30.
Okay, we'll adjourn for 30 minutes and resume at 1:30. Thank you.
Thank you.
This session, the Yoorrook Justice Commission hearing block 7 resumes.
Well, thank you, Chair. Co-chairs, before lunch, I was asking you some questions about the way in which the statewide treaty and traditional owner treaties might operate to meet some of the challenges we've been discussing. I'm not sure whether you can, but given that the state of Victoria, together with the health related Aboriginal community controlled organisations, have committed to the Corran Bowat Aboriginal Health, Wellbeing and Safety Strategic Plan 2017 to 2027. That document's already there. Are there things that come to mind that might be able to be done in that same area in a treaty that haven't been able to be already done in the strategic plan?
I think really in answering that question, I'll draw back from the review that was done by the Productivity Commission onto closing the gap, and more broadly, what it identified is that to get better progress in these areas, including in health, we need to make sure that there's greater accountability for government on actually delivering on its commitments. And we need greater levels of self-determination of First Peoples actually being empowered to make decisions within these spaces. And that is a consistent theme across all these areas, and something that we'll continue to reiterate as the Assembly, because we see it as a critical role of treaty to address that.
Is it also the case that from your previous answers, the commissioners can understand that you say that there needs to be greater coordination across the various sectors?
Yes, absolutely.
Well, that's something that the Productivity Commission report mentioned in terms of there not being sufficient whole of government approach to meeting the challenges of the close the gap targets.
Yeah, absolutely. They need to be seen as an interconnected series of targets, not as standalone targets.
I just want to take you to the 5 urgent areas for action that you've identified in your written submissions. We've discussed at some length with respect to education, tackling racism, and much of what has already been said will apply equally to the health sector. Is there anything else that at this point you'd wish to add that is specific to health in relation to racism?
Not specifically. I think a lot of what we're talking about in here is covers off on that, and I just flag that that conversation we had before around that racism, that those different degrees of racism need to be fully understood, and oftentimes those racist attitudes, the things we perceive as racist attitudes, the perpetrators of that actually feel like they're acting in good faith and not even realising that they're demonstrating acts of racism, and that's a really important aspect that we need to continue to unpack.
And you would accept that, and perhaps it was the Assembly's intention that this particular Commission of Inquiry play a role in helping to educate the broader community and do its part in avoiding the perpetuation of bias.
Absolutely. It's really critical that Yoorrook is able to provide that resource for the broader community, and to have that, as I said, that ground truth, so that there's that reliable place that people who are interested in wanting to make a change in this space within themselves know there's something they can draw from to see what actually does need to happen.
Second area for urgent action that is identified in your submissions is the support for stolen generations. Can you just expand on that a little bit for the commissioners?
I don't have too much further that I'd add in that space, but just to reiterate that this continues to be a concern for our communities, and that was very clearly demonstrated, I think, through the strong community showing we had at the recent apology from the police in particular, and that was very powerful to have the Chief Commissioner recognising and acknowledge the role of police within the stolen generations. And that's something that I think would be positive to see across the board, to have that recognition from government of their role they played as one of the many ways of enabling us to move forward in that space.
And so in the health area, the support for stolen generations would also include support for their children and grandchildren who may have suffered from intergenerational trauma as a result of their parents' or grandparents' removal?
Absolutely.
Is it also taking into, in your understanding of the reference to stolen generations, is it intended to take into account the current children who are presently in out-of-home care and have been removed from their families, or is that a different subject?
I'd say I'm not in a position to comment on that distinction at this point. I'd say I think we need to be always wary that we want to make sure, regardless of how we're describing things, that First Peoples children need to have every opportunity to grow up with their families, just like every child should have the opportunity to grow up with their own families.
We heard some evidence yesterday from the co-chairs of Ngarra and Maru about the failings in respect of elder care. That's another item which you've identified in your submissions as a matter for urgent action. Can you just speak to that particular?
Yeah, it is really critical and something that touches all of us as First Peoples, and especially when you consider some of those health aspects of First Peoples' life expectancy being much shorter. That means that there's less time for us to spend with our loved ones, our elders, and ensuring that there is appropriate care for our elders is absolutely critical.
One of the issues that arose yesterday was the lack of community operated facilities for elders, aged care facilities. Is that something that's of concern to the Assembly as well?
Definitely.
The next issue, which has been identified in your submissions, is social and emotional well-being. Can you just expand on that, please?
I think it's part of that broader reflection of health from a First Peoples perspective, and goes to the holistic nature, not just when we talk about all these different elements within the matters we've been discussing, but within that health area in particular, is that sometimes I think it can have too much of a narrow focus on, your blood pressure as an example of indication of health. And I think as First Peoples, we look at it more to do with our connection to country, more to do with our spirit and our soul. And that's something that needs to be much better reflected and understood within how we go about addressing these matters.
So in terms of urgent action, is there something in particular that the Assembly has in mind that the government could do?
I think, as with most of these matters, we'd echo the calls from our experts in this space within the community controlled sector, and advocate that the things that they think are the best outcomes are what should be happening.
The fifth urgent matter is the support for First Peoples with disabilities. And we've had a Royal Commission into disability, which had some focus on First Nations people with disabilities. Are there particular aspects that the Assembly says ought to be dealt with in this area as a matter of urgency?
Nothing more specifically than what's within our submission, but I just add, in light of the previous conversations we've been having, that for First Peoples with a disability, this is just another really significant element of that compounding factor that is added to their load alongside being First Peoples.
Commissioners, I propose to move on to housing and homelessness now, unless there are any questions you'd like to ask before I change topics.
think just thinking about at lunch, what you said is really, we've got the experts coming in, so don't take it as a sign that we're not listening or not asking, but we do take on board and really thinking about when those experts come and what you've added to that conversation is actually helping us think about what that can possibly look like. So just wanted to, we're not asking, that's probably why.
Thank you, Commissioner. Okay. I'll start by asking a broad, open question, because it may be the case that many in the broader community don't really have much visibility or knowledge about First Peoples housing and homelessness issues. How big an issue or how significant an issue is housing and homelessness for First Peoples?
It's a very significant issue, and we've got some statistics obviously outlined within the submission itself. But to me, at a fundamental level, it comes down to this concept about intergenerational wealth. That the reality is, if you look at First Peoples today and you consider the lives of their grandparents and their great-grandparents, there was no scope for our grandparents, our great-grandparents as First Peoples, as Aboriginal people living on this place. It's inconceivable to think that they were owning their own homes in those times because of the systemic racism of impacts of colonisation. And that just leaves us so far behind the 8 ball when we come to the generations today. There's been basically zero capacity for that intergenerational wealth. And that leaves us today in the position where we're unable to access that home ownership market in a time now when it's harder than ever it has been for anybody. When you compound that again with the fact that we don't have that intergenerational wealth, that means that area of housing and homelessness is of significant concern, and often that leaves us as First Peoples having to be in inadequate housing, unsuitable housing, and that then leads to the compounding concerns around education, employment and health.
I take it from your answer that you're identifying the transfer, the entry into the property market with the transfer of intergenerational wealth as a significant factor in people's well-being.
Definitely.
And the inability to engage in that very basic, fundamental level of economic advancement on a family unit level, it has been significant for First Peoples in Victoria.
Definitely.
And so is it the case that you have available to you any materials that have where there are studies or reports as to the difference between the outcomes for people who have access to intergenerational wealth through housing, or is that material not something that you know of presently?
Not specifically, but I think it's borne out. And when you look at the differences in outcomes in home ownership for First Peoples, there's a clear and obvious link there to that intergenerational wealth.
And that in turn is connected to the whole of the colonisation and dispossession process?
Absolutely. And I sometimes kind of liken it to a game of Monopoly where the board was set up and we as First Peoples were living on these lands and sharing our lands and thriving on our lands, and then colonisation has occurred and we've been removed from being able to play on this Monopoly board, and other people have come and taken it over and put on their hotels and their houses, and we've been left to then pick up the pieces afterwards and keep rolling the dice that has us landing on other people's hotels and having to pay. And unfortunately, the reality is there's more go to jail spaces for our people as well. And all those things compound to leave us in these positions today.
Thank you. At page 37 of the submissions, the Assembly makes the observation that secure housing is fundamental to safety, economic participation, psychological resilience, and physical health. Can you just explain what's meant by the connection between secure housing and psychological resilience?
I think a home is such a critical thing, especially for young people, that when you have that one space where you feel safe, where you feel happy, where you feel secure, that's fundamental. And when you don't have that secure home, when you're not sure whether you're going to have to move next week to somewhere else, where you're going to have to go and have to sleep on the floor of your cousin's house, when there's that uncertainty about that, when you don't have that centering of a home, that clearly has a fundamental impact on people's lives.
You then go on to observe that Mana Ngā Warn Tian Mā Takot, the Victorian Aboriginal Housing and Homeless Framework, states that for First Peoples, a culturally enriched home supports mental and spiritual health and helps maintain a strong connection to their culture, providing strength and resilience at difficult times. So that is consistent with your observations a moment ago about psychological resilience being one of the consequences of secure housing.
Correct.
The Victorian Aboriginal Housing and Homelessness Framework, is that comparable in a broad sense with the Murrung Aboriginal Framework?
In what way?
Being a government sector framework for delivery of better outcomes for First Peoples?
I believe so.
It's addressing housing and homelessness, whereas Murrung's addressing, the educational needs, and again, further, the Koran Korumballat health strategy is another sector-wide strategy for improvement of outcomes for First Peoples. So we have these frameworks or strategic plans that have been designed with the Aboriginal community controlled organisations, and is it appropriate fair to assume that they represent at least the best attempts by the community and government to make substantial change in their respective sectors?
I'd say they represent a very strong attempt to address that within a limited scope. I almost kind of think of it as a thoroughbred horse, but with blinkers on. But it's through a very narrow focus, and it's, as I said before, it's within the kind of existing sandpit that it's trying to do that, but it hasn't got the scope to kind of step out of that and think, well, actually, are we going about this the wrong way from the beginning? So I think within that scope, it is endeavouring to do the best that it can. And really, it's amazing that we've got so many of our First Peoples experts stepping up to, despite what they've seen from government across years, to think actually this is a chance to make a difference. And so there are some positive things that come from it, but it's still limited in what it can achieve because of the structures we've got in place.
And as you've noted, there are some areas in which those plans and programs are achieving outcomes, beneficial outcomes.
Correct.
But as we will hear from many of the witnesses over the coming weeks, in other areas within those same plans, the progress is slow and in some parts non-existent.
And I think it would be really interesting and powerful and useful across this process when talking both with the Aboriginal community controlled experts and with the government to be able to identify, are there particular pinch points where there is decision making that's preventing us from getting the best outcomes, and how can we identify some of those decision making moments that a transfer of that decision making to First Peoples would actually lead to far better outcomes. because those are the groups, those are the experts who are going to know exactly where those pinch points are. When you're within that system, they'll be able to identify that, and that's the types of things we're hoping to leverage to then deliver through treaty, the opening up of some of those pinch points.
You comment in the submissions at page 41 on the Victorian Home Buyer Fund. I might just ask the video operator to take us to paragraph beginning to address that. I'll read that paragraph to you from your submissions. It says, to address the increases in the housing market, the Victorian government created the Victorian Home Buyer Fund, a shared equity scheme to make home ownership more achievable for Victorians. However, the program requires participants to partner with the Victorian government to secure a deposit for a property. This is not a culturally safe option for First Peoples due to the mistrust First Peoples experience with the Victorian government. Can you just expand on that a little for the commissioners?
I think it's obviously an ongoing concern for First Peoples, and no doubt laid very clear across repeated hearings for Yoorrook that there are ongoing trust issues with the Victorian government. And so when there's a compulsion to have to kind of sit within that system to achieve some of these outcomes, sometimes there can understandably be a reluctance to sit within that system and have that engagement with government because of the demonstrable things that have happened across generations to First Peoples through government.
It will be some time for many people in the First Peoples community before they can trust government. You would agree with that?
I would agree with that.
If ever?
Yeah. But I'm hopeful that this process we're going through, when we can actually see agreements made, we can see commitments not just spoken about, but actually signed up at a nation-to-nation level for treaties, that will help give some of that capacity to build that trust back.
Further on page 41, you note that the Victorian government's lack of understanding of tailoring services or programs to the specific needs of First Peoples is also evident in the support programs provided for securing private rental. The Victorian government has committed funding to the Aboriginal Private Rental Assistance Program, APRAP, which empowers First Peoples to navigate the private rental market. However, it does not service the entire state and replicates the same program for non-First Peoples. And so is it the case that the Commissioner should understand from that submission that there are parts of the First Peoples community in Victoria that don't get access to this program?
Correct.
And it's the program is not specifically tailored to First Peoples, or is it simply a restatement of the non-First Peoples program, or is there? Are you familiar enough with the program to say whether, in fact, it does have aspects to it which make it specifically valuable to First Peoples?
I'm not familiar enough with those details now.
But the failure to make it available to First Peoples across the state in that program, and the Victorian Home Buyer Fund difficulties indicate that in creating these programs, which First Peoples ought to have access to and ought to be and could probably easily be tailored in a way to ensure maximum uptake by First Peoples, that hasn't occurred, notwithstanding the framework on housing and homelessness.
That's correct. And I think in this space, it's very similar. And again, there's recurring themes again and again to when we spoke about the issues around employment of if you have to choose between two people who you're going to employ, there's a similar conversation about real estate agents, homeowners, if they have to choose between who they're going to provide a house to. They're more likely to provide a house to someone that they have a stereotypical positive view of, as compared to someone that they have an unconscious bias against. And that's just the reality we come up again and again and again and again with.
Yeah, and it's important to note that it's all interconnected between housing, health, education. Like the grim statistics are a reflection of colonisation and inequality that we come from, and the government inaction that's happened over decades hasn't helped at all, and it does need a bit of an integrated approach. So looking at whole system change, and that's what treaty's about, transformational change, and it takes time because it's really embedded in all systems that we're part of. And I think the absence of inherited wealth and community collateral has played a big part in that, around the deficit within housing within that thematic area. And I hope that the Aboriginal Housing Board will be part of this hearing and talk to their housing and homelessness strategy, where it looks at within a generation, making sure that everybody has a home within our community, and looking at homelessness, transitional support that's required to get to renting, where we experience racism, when applying for rentals. There's a lot of stories that can be shared there. And then also how we go into home ownership and have that wealth and prosperity that we need into the future, because the reality is a lot of our people are poor on their country and they're homeless too, and they shouldn't be on their country in that position. So there's a lot of work we need to do within the system to change, and I think it will take time because they've had a 250-year head start on us, so we're unraveling all those complexities. And I think having our experts within health, housing, education, they do play an important role, but they're not actually always consulted or resourced or supported to address the inequalities to enable kind of positive change. And they're so stretched across their areas, and you'll probably hear that will be a kind of reoccurring theme around the lack of support, because our people know best. We're the experts on our people, our country, our culture, but we're not respected and valued in that sense to be able to deliver on the majority of our objectives because of the lack of support and resources. But it is important to know that it all goes hand in hand across all those thematic areas, and the statistics represent us. It's us that has 10 less birthdays. It's our old people that we talk about. It's our people in the community that are experiencing racism in their everyday interactions. So that connection is real, and it's a reality for us too across, the deficit. And we're trying to look at the strength-based and rights-based principles that we need to head into a treaty era and what that will look like. So the future thinking that we need from our organisations is really important, and for them to get treaty ready, shift into that era, because it played a really important role in our advocacy over generations and the creation of our community control sector and our organisations and that philosophy that we carry. But now it's a different time to go into a different part of our future, and that's what we're trying to shift everyone to, that mindset we need to shift to enable a future with treaties, and it will be for the generations. So it's going to take us time to get there. But I'm truly confident that we're on the right path, and Yoorrook will create that path, and we'll make sure that we hold government to account. So I just wanted to mention that. Thanks.
The advocacy's been there from community, but the power and authority is not rested with us. Would be fair to say?
Exactly that. That power and authority and the ability and tools we need, that's what we'll be looking at to negotiate in the statewide treaty, to shift that power and decision-making powers where it applies to our people across those thematic areas.
Ngarra, I might just follow up your comments with a question that I'm not sure that it's an easy question, but is there a change of mindset that the community organisations are going to need in order to come to terms with a fully self-determining world as well, having been in a situation where they are essentially given the crumbs or told what to do by government agencies for the whole of their existence. Is there a learning curve for the organisations too, and changing their mindset?
I think that we've all got a role to play and responsibility when it comes to the treaty landscape. And I think they've had a really strong history, our community-controlled organisations, over 50 years, some of them. So they've played an important role in our advocacy and kind of shaping policy and holding government to account. But I think that there's a new era that we will shift into, and it's all of us together. So how we actually all come together as traditional owners, as a community control sector, will be really important from a statewide treaty level, but also in the local treaties, because traditional owners will have their aspirations and goals within their own countries. So it's important those relationships are respected, but also respecting the history and the philosophy of our community control sector, because they have an important role to play. They are our experts. Like, we don't sit here as health experts. A good example for us is where we created the Self-Determination Fund and Trust because we wanted that financial expertise, and we still have the control of the fund, but we put it to the experts to lead. So that's an important design within the system we currently are kind of looking at around our treaty foundation. So there's definitely ways we can look at relationships in regards to that. But I think that's just one example where we've got that power, and that's what we want to do, is give that power and autonomy to the organisations to lead, because they know best the solutions, to their own problems in their communities. So, yeah, I hope that answered your question. It's a big question.
Yes, it kind of answers the question. Thank you. We will come back to ask some questions about the Self-Determination Fund a little bit later. I just want to conclude these questions in relation to housing.
Can I jump in for 1 sec? Just to complement that question there, and that was directed at what community need to do. But can we hear from you around what government need to do in order to enable this to happen?
Yeah, I think government is on this journey, and they've been talking about self-determination for a while now, as you're well aware, as the Commission's well aware. And I think they're starting to slowly unpack what role they need to play in this. And it's gradual steps we continue to see, but ultimately it's about the elements of government and our public servants themselves realising that what we're headed towards is a space where First Peoples are empowered to make decisions about things. And so there needs to be that mindset shift within government about that they won't necessarily have all the control and have control of all the levers anymore. There's going to be a space where we agree that this is a space where First People should be making the decisions. And that's going to be a significant shift for some elements of government. But I think it's one that we're on a strong journey towards.
Right. I mean, because when the Premier came and gave evidence a few weeks back, Premier did articulate to us that some departments will be a little bit more progressed than others. Is there any sort of, do you have any views on that? Should government just be ready to go when yous are ready to go?
I think, as we've said before, that you can't rush some of these things because we've got to make sure that if we do transition, we transition with strength. And part of that is making sure that the departments themselves are ready. But the departments are gearing themselves up, as they should be, to be ready for this. But this is also, it's not a sprint, it's a marathon.
Thank you. So on page 41 of the submission, you set out the two recommendations at recommendations 3.1 and 3.2 in relation to affordable housing programs at 3.1 and access to private rental at 3.2. At 3.1, it's noted that the Assembly recommends that Yoorrook research existing affordable housing programs that provide opportunities to enter the housing market. You referred to the Manana Warren Tain Mark Takort recommendation of various options to make home ownership more accessible for First Peoples under its Goal 3. To be clear, your the recommendation that the Assembly is making is that Yoorrook use some of its resources to do that research and make some of its own recommendations?
Yeah, I think that there's been some powerful recommendations already put forward, but I think it's important to be able to look at those recommendations in the broader scope of the conversations we're having as well.
And then with respect to recommendation 3.2, the Assembly recommends that Yoorrook review the report and recommendations from the Residential Tenancy Commissioner on Aboriginal private rental access in Victoria, titled Excluded from the Start, and the recommendations under that particular report. So there's clearly a view that access to private rental remains a problem. You've spoken about the difficulties of obtaining private rental for First Peoples, dealing with more overt racism, but sometimes bias, unconscious bias.
Correct.
Then at page 43, you make recommendation 3.3 regarding urgent support for First Peoples households on the VHR waiting list. And what sort of support are you recommending in that paragraph? Are you able to speak to that?
I don't think I have anything more specific to add than what the recommendation has there, but that's just referring to 3.3, not 3.4. Is that correct?
Yes, that's correct. At recommendation 3.4 is that there be transfer of public housing units to long-term renters, and there's a reference in the submission to a program in the 1960s where the Housing Commission started selling public housing units to tenant families to generate more funding. And you observe Assembly members have acknowledged that their own families who have lived in Victorian government-owned public housing units for over 30 to 40 years have likely paid the equivalent rent to paying off a mortgage on a private property. So it's recommended that Yoorrook research the historic transfer of government-owned public housing units to understand the possibility of transferring current public housing units to First Peoples families to support the opportunity to create generational wealth. There are programs that exist in other places around the country, and I think some federal government programs for transfer of housing that was held by Aboriginal housing co-ops to First Peoples. Is that the type of program that's being referred to there?
Yes, and this is, as it says there, this is something we are hearing about a lot from our members, echoing the concerns of their community, that it doesn't seem right that we've got our orders having been in places for that amount of time and having paid enough that they could have purchased it, but not being in that position to be able to have done so.
Then further on page 43, there's a recommendation 3.5 with respect to the accountability for mainstream organisations providing housing to First Peoples. It's noted that in 2020, the Community Housing Industry Association of Victoria launched the Community Housing Aboriginal Cultural Safety Framework, which provides for guidance and tools for mainstream community housing providers to support First Peoples renters in a culturally safe way. It's also observed in your submission. However, there are no accountability measures or reporting mechanisms to ensure the tools are being implemented. Assembly recommends that Yoorrook ensure the community housing sector is accountable for providing support to First Peoples renters in a culturally safe way so that they have more options to access community housing. And you're asking Yoorrook to take that up as one of its research areas and recommendations.
Correct. And I think it's important to highlight that this is again a consistent theme, in that we want to make sure that there's opportunities for First Peoples to access First Peoples led services in a variety of spaces, but there still needs to be that element of self-determination that if they choose to access other services, they should be able to. And there are still obligations on the state to provide those services in an appropriate way. And so there does need to be some level of accountability to make sure that's also happening.
Yes. Yes, indeed. Recommendation 3.6 refers to the release of a social housing regulation review. And it's noted that the Assembly understands the Victorian Government have reviewed the social housing regulations to identify future regulatory arrangements that best support social housing renters and communities, which include a recommendation to make it easier for Aboriginal community-controlled organisations to become registered housing providers. The final report was delivered to the Minister on the 31st of May 2022, but has not been published publicly. The Assembly recommends that Yoorrook compel the Victorian Government to release this report and address the recommendations.
Correct.
Now, there are then on page 44 some urgent reforms referred to with recommendation 3.7 with respect to homelessness. The recommendation at 3.7 is that the government implement recommendations from the blueprint for an Aboriginal specific homelessness system. And again, the Assembly recommends that Yoorrook review the framework to implement a First Peoples specific homelessness system developed as an outcome of the Mananawarntain Court framework. It outlines the barriers First Peoples currently face and provides a pathway to creating a better system to support First Peoples out of homelessness. Homelessness isn't an area that either of you have worked in directly. But clearly, the blueprint for specific homelessness system has done much of the work that needs to be done, and it's a question of ensuring that that blueprint is implemented properly. Is that the recommendation?
That's correct, and it's another one of these areas where there is already identified some action that should be undertaken, and it should be undertaken. There's no need to wait for a treaty process to undertake recommendations that have already been made. And we see that in the future, there is scope for some of these ideas to fall under the lens of treaty, particularly in terms of future adjustments and future amendments to such strategies and plans to make sure that there's a duty to consult with First Peoples on that. Not that it's just consulted on the whims of the government at the time, but there's an obligation through treaty to consult on these sort of initiatives. But there are initiatives in place now. There are strategies in place that have already been identified. And we want to make sure that the government is delivering on these things. And I look forward to hearing Yoorrook have direct conversations with the parts of government responsible for this.
And finally, there's urgent reforms that are recommended with respect to transitional housing. And that's at page 44 and goes over to page 45 in recommendation 3.8. And that's that the government adopt a housing first model, and the Assembly picks up the recommendation from the Mananawarntain Court's recommendations for a housing first model as a proven approach which connects people's experiencing homelessness with Aboriginal housing Victoria. Again, this is pointing government to an existing program and asking for implementation of that program. I think it's the terms used are as quickly as possible and without conditions.
And I'd particularly actually highlight that next line that acknowledges that housing is a human right. And that is absolutely critical to have that understanding that this is not some high benchmark of people being able to have housing. It's a basic human right to be able to have somewhere to live. We should not be living in a society where there are people who don't have a roof over their head or somewhere to live. And unfortunately, this is an area that affects many peoples, but it has a particular impact on First Peoples as well. And I'm not sure what type of society we want to have, but I'm pretty confident we want to have one where everybody has a chance to have a roof over their head.
Well, it's not only and not diminishing from the human rights aspect of the right to secure housing. In the hearings before this commission on the over-incarceration rates and child protection, the absence of a suitable transitional housing was shown to be one of the indicators of recidivism.
Absolutely.
And so people were being released from institutions, not having housing to go to, and finding themselves back in contact with the justice system.
I did, if I could, just want to comment more broadly on some of these statistics we've been looking at as well across all these areas, because I often fear sometimes that when we are highlighting some of these discrepancies in outcomes for the First Peoples communities, that there could be a tendency for some people to look at that and get the impression that there's some sort of inherent deficiency in First Peoples that would mean that they have these discrepancies. And that would be completely the opposite wrong outcome to draw from this, the wrong conclusion to draw from this. Regardless of who anybody was, if they were placed in the same shoes of First Peoples across these generations and experienced the same discrimination and exclusion, they would find themselves in the same position. This is nothing to do with some inherent flaw as us in First Peoples. In fact, I'd offer that because of the strength we have as a people, we are, despite all this, we'd be in a better place than other communities might find themselves, having endured the same atrocities. And I also think that sometimes when we are looking at the statistics, and it's useful to look at statistics, but there's also a tendency to think, well, from other people's experience, they suffered hardship and they were able to succeed. And that's true. We can point to cases where First Peoples have been able to succeed despite these hardships. And I would say I'm a proud example of that my father experienced extreme hardships and was able to work his way out of that and ensure that his family would find ourselves in the positions we are. But it's about the odds. The likelihood that Aboriginal people are able to overcome all these things and succeed is so low. And the vast majority of our people can't do that because of all these compounding things. And so I just think that's so critical for the broader community to understand when they come into these conversations, that there's not some inherent flaw with us as peoples, and that we're not saying that there aren't the very few of us who are able to prevail despite this, but that this is the situation we find ourselves in. And that's really, really critical, I think, to understand.
So the terms of reference for this commission ask the commissioners to look at the past and ongoing injustices, and so in some senses, there's no capacity to avoid discussion of some of these issues, or all of these issues, indeed. But it also asks the commission to look at the resilience of First Peoples in Victoria, and so there are many examples of the way in which, notwithstanding the incredible hardship, First Peoples in Victoria have maintained their communities and their capacity for care and care for their country and care for their communities in a way that perhaps other communities wouldn't. Would you agree with that summary?
Absolutely.
Can I just add that this morning from Professor Lovett that we heard exactly that through his study, that I think he was talking about particularly health statistics, that people think we're diseased when you look at, that's the interpretation. And I think you've said it on a bit broader scale there, that people don't take in all the factors that's the past is the present sort of, and having a look at why it is the way it is. So it was great hearing that again, 2 days, two sessions in a row. I think it just goes that we need to look deeper and understand the past, and people really need to understand those connections. And we take that job very seriously in the commission to make sure. So thank you for reiterating that.
Now, I intend to take you to your submissions on economic matters. Firstly, I might ask whether it's appropriate to read from your written submissions for the commissioners to understand, I suppose, that there is an amount of work that's still being done by the Assembly in relation to the form and shape and perhaps the content of economic self-determination as far as the treaties process is concerned.
That's correct.
And so that's both at a statewide level, yes.
Mhm.
But is there also some consideration that the Assembly has to make in respect of the right of First Nations to be self-determining about their economic development?
Yeah, and ultimately that will be up to the traditional owner groups themselves when they're negotiating their local traditional owner treaties. But there's definitely a role in the system-wide reform within that space for the Assembly to play. Absolutely.
And so, can you just perhaps explain for the commissioners how the statutory self-determination fund fits within that framework?
Yeah, absolutely. So it was one of the key elements of the treaty process that needed to be put in place was this self-determination fund. So it was required under the legislation that also set out the treaty process more broadly. And it has two key focuses, the self-determination fund. One is on the initial focus is on supporting traditional owner groups as they go about progressing their interests in treaty. And the longer term priority is around wealth and prosperity for First Peoples. And it's, to my mind, it's a really powerful example and a model of where we're headed towards in a self-determined space. It's in the name itself, the Self-Determination Fund. And surprisingly, when we were having negotiations with the state about this, not to go into too much detail, but it was a constant thing we needed to remind the state that it's called the Self-Determination Fund because it's supposed to be self-determined by First Peoples. And we've set it up as essentially, I would say, an independent element of the Assembly. We recognise that some of the decisions the fund needs to be made at an arm's length from the 33 members. And so we've created this entity as the Self-Determination Fund as a trust. We have appointed the trustees who manage it. We have given them directions, but they manage the day-to-day operations of that fund. And the state has transferred the initial amount of funds to that. But aside from that, it is up to the Assembly to ensure the oversight of that fund. And it's a really powerful example of this start towards really true self-determination in this space. I think there's still scope to grow within how that can operate, but it's a really strong starting point.
So, in listening to your answer, are the commissioners to understand that perhaps in earlier discussions with the state, some of those tendrils that you referred to might have been lingering in relation to that fund?
Yes, that would be correct.
And has that been resolved to your satisfaction at this point?
Yeah, and I think there is obviously obligations the state have when they're talking about transferring funds to First Peoples. There are obligations to the broader community, and we're well aware of that. And so we needed to make sure that the state could identify what its interests were. What did it want to make sure that at a higher level the fund had in place to ensure it was undertaking good governance? And then we gave warranties to show that, yes, we have those things in place. And we recognise that as we progress these conversations, that requirement for oversight, for a better word, of how a body like the Future Assembly, a body like the fund undertakes its business is really important. Because we not only want to have the trust of First Peoples in how we do our business, we need to make sure we have the trust of the broader community as well. So we don't shy away from the fact that there does need to be some level of oversight of these self-determined entities we're creating, but there needs to be a limit of how far down those tendrils go.
Given that the Assembly's still doing work on the economic independence aspects, I don't propose to ask you too detailed questions, but as the Assembly's position advances, is it possible for the Assembly to make further written submissions and inform the this commission as to where it sees those funds going?
Absolutely, and happy to give a commitment to the commissioners to do so.
One of the issues that does arise, and you may wish to comment on it or not, but the observation can be made that in the course of the treaty process, it's likely that there will be large, difficult policy areas to navigate, which may have the effect of opening up certain aspects of redress or reparations. In having those policy discussions, the observation could be made that the Assembly, being the collective of its members, is in a far better and perhaps more powerful bargaining position than individual First Nations. Is it the case that the Assembly's going to leave all of the negotiations about the individual redress to the First Nations, or will it do perhaps as requested by First Nations in terms of developing those broader political policy strongholds, I suppose? Headlands, perhaps.
I guess I look at it through the lens of there is a clear priority of the fund to look at wealth and prosperity for our communities moving forward. And a key part of that is being able to make sure that all First Peoples have that opportunity to have the same levels of success that other members of the community does. And what it takes to get us there is what we're going to still have to have conversations about. But it's very much a forward-focused approach on making sure that the next generations have a greater chance of success than the previous ones. And we'll be obviously wanting to work closely with traditional owner groups and other groups who want to advocate in that space to make sure we can have a coordinated approach to that and to leverage the role of the Assembly within those conversations.
Yes. It's not, well, your submission doesn't say this, and I've not heard you say this orally today, but is it the case that Assembly would rule out there being an additional fund for the holding, for instance, of redress in a pool to be distributed as needed later in the negotiation period for First Nations?
I think that's one of many different options that we're looking for about what the best way to move forward on this space will be.
Thank you. The Commission will hear evidence from the Treasurer on the last day of these hearings, most likely. Are there any particular messages you would take this opportunity to pass to the Treasurer from the Assembly via the Commission?
I think that we've seen within the setting up of the Self-Determination Fund, there was awareness that the funds that have been provided are not sufficient to meet the needs of what the fund has been established for. And we know there's going to need to be an ongoing conversation about that. So that would be of interest to understand where the government's current position on that is. But also we know that in other spheres, there are conversations around how First Peoples can better engage with the economy and draw from a lot of the powerful testimony we heard, particularly around land injustice. And just to reiterate that we already have a First Peoples-led fund that can actually service and support those sorts of contributions and conversations. So there's no need to necessarily reinvent the wheel, would be a conversation I'd be making sure was had there.
Thank you. Now, Commissioners, I understand that Ngarra would like to make some closing remarks. Are there any other questions in relation to the economic interests or the other topics that you might wish to ask before we conclude this session?
A couple, if that's all right. Just I'm going to be asking many people this, but I asked yesterday. I asked earlier about closing the gap targets and the progress towards closing the gap. We've talked a lot about the targets. over these hearings to date as well, but also progressing work at treaty. Clearly, that's a direct function that the youth mob have. Do you agree that we need to progress the work in closing the gap in parallel to the work of progressing treaty?
Definitely.
And when our people are used as political football, what impacts does that have on our people's health and well-being?
It can absolutely have a significant impact on our health and well-being when that does occur, and sadly it occurs far too often. But I think that within my conversations with the First Peoples community and with the ACOs, with the traditional owner groups, there is a strong sense of us being united in this space, and that it's through that we will be, again, demonstrate our resilience, but we will hope that there will not be that continued treating of us as political footballs, and call on government to not treat us as political footballs. But I know that through unity, we have strength and we can weather those storms as well. I'd rather not have to weather the storms, but I also have confidence that with our unified approach, we can.
And just one other thing, the Treasurer was mentioned a bit earlier. Have you had much engagement with the Treasurer directly yourselves to date?
Not to date. I did just want to add just one other element before we go to Ngarra, if I may. It was just, I know we've been speaking at times about this contrast between treaty and the timing of what needs to happen now. And whilst I know that for treaties, some of those outcomes are much longer term that we're hoping to achieve, we are hopeful to achieve some shorter term outcomes in the not too distant future as well. So there needs to be that, I think, strong consideration of what are those structural things that we are able to achieve through treaty in the not too distant future, and what are those things that are immediate that need to be done, and make sure that all that is happening. Because I don't want to give mislead this idea that treaty is still a long way away from achieving some of its outcomes. We are hopeful to get some of those first outcomes around treaty within the next 18 months to 2 years. But there's still a lot more that work needs to be done, both from ourselves, but also from government, to actually start delivering on the things they can be delivering now.
Yeah. Thank you, Commissioner. I might invite you now to make some closing remarks, Ngarra.
Yeah, just in closing, on behalf of the First Peoples Assembly, we just want to give our profound thanks to the commissioners for the important work that you are all doing. And we thank you and the whole team. And we want to extend our thanks to everyone who has taken this seat. And it's not easy at times, but I know a lot of the conversations had here, are hard going. But I think we really got to look back if we want to move forward together, so we can see how important the work that you're doing in our community that come in and tell their stories and share their truths. Most of all, we want to thank all those people that come in to contribute to the truth-telling process and have shared their stories. We know there'll be more mob coming in over the next couple of weeks to tell their truths. And a lot of our mob have talked about the hardships that people have gone through and explained the barriers and challenges they still face, and have given us all a glimpse of needs, hopes and aspirations for the future. So these truths are helping us find the path forward, and treaty will help keep us all on the path. So I really think that Victorians can handle the truth. They are ready for it and they need it. And a lot of people, even the Premier, as we learnt early this month, that don't know the true history of our country and the extent of what has happened to our people. So it's hard for them to understand the problems that grew out of that history, which we still face today, which we've talked a bit about today, and I'm sure the community-controlled sector will reiterate that as well. And this is why, Yoorrook is just so vital to our future. So again, just thank you on behalf of the Assembly, and it will help us to get treaty done. And when we really thrive and come together, we will have a better shared future. And I think that our people have a lot to offer in this state. And most people who call Victoria home want to know about our culture and our story and expand their knowledge of our history. So I thank you for taking up these roles. And I know that these conversations are helping us to move into the future with a treaty landscape. So thank you and appreciate you all. Thanks. And thank you, Tony.
Thank you. Thank you so much. I'd just like to ask you one more question before we finish, and that is the Premier has also committed to making an apology in the future. And we have no idea of what her thinking is there. I don't know if you've got an inkling or she's got something in mind that she hasn't told us, but we're mindful of that as well, that there's something there on the agenda, but no real communication is there about anything at this stage about it. But just noting it for the record.
Thank you.
Thanks.
Chair, there are some administrative matters to attend to before we rise for the day. There's a tender list which you have been provided with. First, with respect to this morning's witness, Professor Ray Lovett, there are 4 documents in the tender list. And then with respect to this afternoon's witnesses on behalf of the First Peoples Assembly of Victoria, there are 3 documents and they all appear on the tender list, and I tender those documents. Thank you.
Thank you. That shall be entered into the records. Thank you very much, Council.
There is nothing further this afternoon, Chairs, and we rise today to return next week with more witnesses. There won't be any further witnesses this week. That concludes the hearings for today.
Thank you. Thank you.
Thank you.
Commission adjourns till the next hearings. Thank you.